Hey everyone. On this episode, my guest is Nicolas Smit. Nicolas is a engineer up in Canada in the Sudbury area in Ontario. He's been working the past year to get elastomeric respirators to healthcare workers and to the general public around the world. He's also working to get the government to promote recommendations to use them as an N95 alternative, and to also have N95s as sort of the minimum for people, as how cloth masks and surgical masks are at the present. Now, I'm going to try to keep the rest of the introduction really short. Nicolas is a free flow of information, and he had a lot to deliver for me in this episode. Because he's really been through quite a bit in the last year in working tirelessly to get better masks and respirators out there and get the information around those masks and respirators out there. And so you'll hear that in the episode, who he's been working with and what he's been trying to get done. And, as the theme has sort of evolved for this program, that I didn't really intend, and this is just how things have rolled out, is that people, various people in government and others, really pushing back against individuals in efforts to try to improve conditions for everybody during this pandemic. And that's completely the theme of this episode as well. And as I felt in previous episodes, I felt sort of, depressed and having less hope for the future of human beings from some of the things that get laid out for me. Now, as you would have acknowledged at the beginning of this introduction, yes, another Canadian, I know not very good proportions of having people well spread throughout the world. That would make a third of the guests Canadian. But I'm not going to apologize this time. I'm not going to do it. It is fine this time. It's not all centered around Canadian BS as the previous two Canadian guests. The topic of masks and respirators, this applies everywhere, and so there is a lot of great information in here, and you're not just going to get steamrolled with Canadian dribble. So you're not getting an apology this time. So I'll let you listen to the episode and listen to what Nicolas has to say about masks and respirators. Enough of me. I'll shut up now. Cheers, guys. So give us a rundown as to how you got started working with masks and respirators in regard to COVID. And you go back to whatever point in the pandemic and what brings you to this point.
So at the start of the pandemic, I was always taking a close look at the news and what was going on. And I was noticing they were talking about these N95 masks. And I was already a little bit familiar with N95 masks because I've worked at mining operations where I've used elastomeric respirators, and people have actually tried to bring N95 masks onto the property. But the N95 masks, even though they have the same technology as elastomeric respirators, they offered less protection, so they weren't good enough. So I just did a basic investigation at first, just did some basic Google searches at first, just to confirm my theory that elastomeric respirators could be used for infection control. So I found all kinds of studies from the CDC from years ago, including one from 2017 in Lou Radonovich, where he said elastomeric respirators would be essential for any future pandemic because there would essentially be an N95 shortage, and that surgical masks would not be effective since they don't fully seal to the face, so they allow a lot of virus particles to escape. And so I realized, instead of taking shortcuts at the time, because when I first started asking the Canadian government to look into using these respirators, they were saying healthcare workers should have to take shortcuts because of PPE shortages. So they N95s, which were up until the pandemic supposed to be disposed of between patient interactions or after a couple hours of use, was then said first to reuse for an entire shift, and then because of the shortage to use for days to weeks at a time, which I also know was dangerous because when you expose sometimes the filter to different chemicals, it could degrade this charge that ends up attracting the particles and trapping the particles. So a big difference between, let's say, a cloth mask and an N95 or a surgical mask is there's something called an electrostatic charge built into the filter. So on top of the regular things that will help trap a virus, this will actually attract smaller virus particles at zero 0.3 microns and also under 0.3 microns. In that way, it stays trapped in the filter and doesn't get through like you would with a cloth mask, which is why when you test a cloth mask, it usually says it doesn't even filter half the virus particles. As you saw, hopefully with the CBC investigation a couple of weeks ago, they had a great videos and news articles about how even N95s that in KN95s bought at pharmacies and Amazon and big retailers, they're actually, a lot of them are counterfeit and don't even meet regular requirements, and they don't even filter the 95% they're supposed to filter. So I first started realizing that the mining industry had quite a few elastomeric respirators and could be quite essential in solving a lot of pandemic issues, since since the respirators were commonly used in mining construction. So I had ties to the mining industry from my time on the board of directors for the Canadian Institute of Mining. And I talked to the Canadian president of the Canadian Institute of Mining, Samantha Epsley, about these respirators. And she actually used the CIM to help spread awareness, but she also talked to different mining industries. So mining companies were starting to donate these respirators to hospitals around the world a little bit over a year ago, in Canada, the US, Mexico, Chile, Peru, Argentina, Australia. But then a few weeks after they started donating them, news articles started coming out because our politicians didn't know very much about these respirators and our government didn't hire the right experts to take a look into them. So they were saying that they were impossible to communicate with and dangerous. So as soon as mining companies saw that, they immediately stopped wanting to donate them because it would be a really bad image for them if they're donating something that could harm others when they really just wanted to help others out. So I ended up working with different politicians, including Franchi of the Ontario NDP health critic, and Carol Hughes, a Canadian MP. And they helped me get both the Ontario and Canadian government to look into using these respirators. And within a couple of days, the government realized right away that it would protect healthcare workers as well, if not better than an N95. Although at the time they didn't really understand the respirators because they had valves, and they assumed that because they had a valve, they could let unfiltered air to escape and infect others. So they started spreading misinformation due to their lack of understanding. So they were telling people to actually not use these respirators and to avoid them. And a lot of those comments haven't been corrected. The politicians still haven't admitted that they made mistakes or that they hired PPE experts that had no prior knowledge about these respirators being used in healthcare settings, despite being used since the mid 90s by the CDC and other healthcare workers and by hospitals for SARS and H1N1. So it was a little bit of downhill effect because as soon as that misinformation came, other people stopped trying to help get these to healthcare workers. So the government ended up officially recommending them in Ontario on May 10th, and the Canadian government and Health Canada officially started recommending them on June 11th. But these recommendations were only put out online. And since these recommendations were not talked about at any press briefing, not a single politician has talked about these recommendations. And they haven't even and the government hasn't spoken to journalists or anybody. These recommendations continue to be overlooked or misunderstood. And even though it's a year after they've been recommended, some politicians are still saying we should avoid using elastomeric respirators because they might scare patients away. They might be hard to communicate. They cost too much. They're uncomfortable. Or you can't properly hear somebody using it. So this is just common misperception. And if they would actually have done a little bit more research and have looked at the CDC documentation or even some of the documentation from inside Canada, they would have seen that there's a long history of use. And these respirators are not only offer better protection than N95s, they also offer sustainable protection. So instead of having disposable PPE, you could keep reusing the same respirator over and over again for years at a time.
Now, you mentioned something the last time that we spoke together about them actually using some of these respirators in Winnipeg. So what was going on there, and how come it hasn't taken off, even though there have been parts of in Canada where they have used them? And so how is it not taken off that way throughout Canada and into the US?
Well, a lot of the problem is there's a lack of communication. So when great innovations happen, for example, in Winnipeg last year, the firefighters, police, and paramedics started using them because they already had a little bit of familiarity with these respirators for infection control, because it's not something new. It's just something that's not well known. And then after it started taking off from word of mouth in Winnipeg, and people like dentists started using them. So that's when CBC first took notice, and they actually had a great article in early May about how dentists started using these respirators to protect themselves, but that Health Canada was telling them they didn't know if there was any evidence they could be used in a healthcare setting. And they're saying these associations would have to test these respirators out themselves. So they kind of tried to pass the buck along to everybody else besides them, even though these associations don't have anything in place to test PPE, especially for infection control. And they don't even have a process in place to be able to do that. So there was a lack of communication. And if the public would have known about this, other cities would have been able to make the switch as well. Cities like New York have actually fully made the switch from N95s to elastomeric respirators for paramedics and firefighters. I believe it was in November they made the switch, but they actually started trialing them out in June to great success. And it's also not very common knowledge that there's also other types of elastomeric respirators that aren't industrial that are made for healthcare workers. And these often get overlooked because people only assume that there's one or two manufacturers, 3M or North, that sell them, and that they're all the same. Uh, so that's been a big hurdle to overcome, is to let people know that, you know, the elastomeric respirators from 20 years ago are not the same ones that were made during the pandemic and made specifically for infection control, that are easy to communicate through. They can be worn for 12-hour days. They won't leave the marks that the N95s will leave. If you've seen the pictures, often at the end of a long day where they're wearing an N95, they have cuts to their face. And you know, a cut or two is better than getting the virus and dying. But there's no reason to settle. You can still upgrade protections. And a big difference between an N95 and an elastomeric respirator is an N95 filters 95% of airborne particles, while an elastomeric respirator often uses P100 filters, which filter 100% of airborne particles, or 99.999997% if you want to be technical. So they offer a greater degree of protection. They're also more well liked by healthcare workers. Back in June, the American College of Surgeons had a large study where thousands of healthcare workers at the Allegheny Network in Pennsylvania and New York used elastomeric respirators after being trained for 4 weeks. And they were so well liked that not a single out of the 2,000 healthcare workers wanted to return to using N95s. So it shows that healthcare workers do like them, despite the government saying we shouldn't even attempt to give them to healthcare workers because they might not like them. That was actually an excuse given to me by politicians in July. Back in June, the Ontario government ended up buying 100,000 elastomeric respirators from 3M. They didn't bother to talk to any manufacturer. They only talked to 3M. They bought these 100,000 respirators. They said they would receive them all by mid-July and then distribute them. But then in mid-July, they received all of them. And then they said they assumed healthcare workers would not want them. So they wouldn't want to distribute them to healthcare workers. And that, for some reason, didn't alarm any of the politicians I had worked with. Franchina was a health critic, and she knew there was big problems with N95s being so short that some long-term care homes haven't had them in over 6 months, from June to December. And she was often going in front of Parliament with other politicians that are great advocates like Jamie West, where they were saying, you know, a lot of long-term care homes haven't had a single N95 in months, and they've been in outbreaks where people have died. And we know surgical masks don't work, so we need more N95s. But then they refused to ask or even let the public know that these were alternatives that were approved by the government. And in fact, I received an email from the Minister of Health yesterday. It was a letter that Jamie West gave the minister for me about elastomeric respirators. And in the letter, in the email, they even say that they've actually been recommending elastomeric respirators as safe N95 alternatives since April, not May 10th of last year, but April of last year, and that it should be used anytime there's an N95 shortage. And they're still using the N95 shortage as an excuse as to why healthcare workers should keep reusing N95s and why they need to keep using surgical masks. because surgical masks don't actually protect healthcare workers. They only prevent the healthcare workers from spreading it to others. So that's a big reason why so many healthcare workers make up such a large portion of the people that are infected. Back in the during the summer, it was about 1 in 4 to 1 in 5 cases were a healthcare worker in Canada. I believe in Quebec it was 25%, and in Ontario it was about 19-20%. And that's simply because we haven't been properly protecting our healthcare workers, who are the most at risk. We've been downgrading protections instead of upgrading protections. And a lot of it is just due to lack of awareness of other protections. Everybody assumes that N95 is the end all solution. And while it's a great respirator, it's not the only respirator, and it's not even close to the best. It's just the minimum level that's acceptable for airborne transmission. But another excuse the government is saying is, well, there's no airborne spread of the virus. For the last year, they've been downplaying even the possibility of airborne spread and saying, well, surgical masks are good enough because we don't have to worry about airborne spread. We only have to worry about droplet protection. But then they completely ignore the fact that N95s and elastomeric respirators do a much better job of droplet protection than surgical masks. So it's just an excuse to let them continue to use the protections that we have seen day after day do not work, which is why unions, healthcare workers, and experts have been asking for months to put N95s at a minimum. And if we were to use surgical masks, to use something called a mask brace, which would actually help fully seal the surgical mask to your face. Even if there's only a 1% gap, such as with a cloth or surgical mask, half the air will go through that 1% gap. So contaminated air will just leak in and out. And the filter material itself might not, if it's not made of polypropylene, it might not properly filter the virus on top of that as well. So there's other great options right now, such as vaccinations are great options, and ventilation. But we shouldn't look at each thing separately. We should look at the combination of protections. So the more layers of protection there are, the more we can guarantee that instead of just reducing the virus, we can actually get to no cases at all. We can get to a zero COVID society by using all the protection combined, not nitpicking what might work and what might not work, and then ignoring science because it's inconvenient, or saying things like we need to take shortcuts because of a PPE shortage, where the US government admitted 2 weeks ago that it doesn't even exist, and that there's actually so many manufacturers, PPE manufacturers, that are now closing operation and laying thousands of workers off because they can't get their PPE to the hospitals, to businesses, to the public. And a big problem is places like Google, Facebook, they put in advertising bans on PPE because they assume because of the shortage, all the PPE should be reserved for healthcare workers. So while the US government updated their FDA website and sent out letters to the hospital weeks ago, they have refused to hold a press conference, talk to Facebook, talk to journalists, talk to Google, and let them know that there's no longer a PPE shortage. So these manufacturers should be able to advertise their PPE. So there's so many manufacturers available now, but there's so much PPE sitting there that some companies have 15 million or 30 million N95 sitting in their warehouses, while healthcare workers are being told to reuse the same N95 for a week at a time because they can't get an N95. So it's the government says one thing, but in reality, it's a completely different situation.
So you gave me about 1,000 things to talk about there, but I guess just on what you just last touched on, how is that possible that we've had these concerns throughout the past 13 months of various PPE shortages, and now there's still more of a demand. Our country in particular is really up shit creek. Both of our provinces are in gloomy days. So how, with such a demand for PPE, and there also seems to be a bit of a tide turning as well from away from the droplet idea and contact idea to a lot more people in government and a lot of scientists who have been trying to get the message out of aerosol transmission are becoming a lot more mainstream and are getting a lot more attention. So it seems that there is already a move, and hopefully a much bigger move, towards wearing proper masks, with people understanding that the major threat is aerosol transmission. So how are these masks not getting out more and just sitting there in these domestic warehouses.
Well, even when they're in hospitals, they're often locked up. Healthcare workers are still told they don't need N95s because most provinces in Canada still don't admit that there's airborne transmission. And for them to admit that there's airborne transmission a year after all the experts, unions, and evidence have pointed to the airborne spread, it would be pretty harmful for these politicians to admit that they refuse to listen to evidence from the start and even use a precautionary principle, which is something we learned back in about 10 years ago after the SARS Commission. We learned that when there's a pandemic, we should take every precaution principle. So we should assume that the virus is airborne and only not use airborne protection once it's 150% proven that it's not possible to be airborne. So while it's sometimes hard to figure out if it's airborne, a lot of viruses that we do know are airborne are still hard to prove that they're airborne, even though we know that they're airborne. So it's hard. It was hard to first admit that there was airborne spread, because if there's airborne spread, it means the virus is a lot easier to transmit, and then businesses would have to take more precautions, and then some of the mitigation measures the country was using at the time would not have been effective. So things like closing the border was great, but when we keep a lot of the businesses open, and a lot of these workers are working in food plants and even in prisons and stuff like that, people are working so closely together, they could easily transmit the virus. So,
and we've seen that at the meat packing plant next door to me in Alberta there.
Yeah, that's a great example. There was, I believe, 950 Cargill employees that were infected, and it spread to 500 people in the community. And that's that we know of. The problem with this virus is it's also asymptomatic. So a lot of people might have the virus and they might not be coughing, but they might still be spreading the virus particles. And we don't, like, we were relying on temperature for the first 6 months as a way to figure out if somebody had the virus. But most of the people that did have the virus did not have the temperature. So it was not an accurate way to protect people. And we also let people keep coming into Canada, and we also let people keep taking vacations. Even over the Christmas holidays, a lot of ministers and politicians were caught taking vacations to the Caribbean, even though they were telling Canadians only to travel for essential reasons. Well, drinking a beer on the beach in the Caribbean is nice, but it's definitely not essential. So the big problem is the science has evolved, but modern politicians cannot admit they make mistakes. And it's not just one politician or one group, but they've all made mistakes. So in the US, Democrats and Republicans both made mistakes. And a lot of times they're still afraid to admit to their mistakes. So it ends up harming society. And in Canada, the NDP, the Liberals, and the PC are all responsible for spreading misinformation. And they now realize that their previous recommendations did not work. They should have listened to the experts this entire time. But now they can't admit that they were wrong, because people say, well, if you were wrong, do you take responsibility for all these thousands of people that died needlessly, and for all these businesses that got shut down for the precautions that didn't end up working? So they would rather let the problems continue to go than to actually address the problems. And they also refuse to be transparent. So a big example of this is back in June, the CBC uncovered that Doug Ford was not really using the best experts in the province to help the Ontario. He was actually choosing people that were within walking distance of Queen's Park. So he was choosing people at convenience. And then
he can't walk very far,
No, and there's probably a few donut shops along the way for him too. And then maybe a couple beer stores too for his buck of beer. But it didn't actually do good. And then these experts were actually muzzled. So back in November, the CBC also found out that the government was not listening to the experts that were supposed to be advising them. The government was saying, for example, they used a measure of when to shut down the cities, and said it was the recommendations from these experts, but these experts blew the whistle anonymously and said, we actually recommended the levels were 4 times lower. So we don't know why Ford has said that. It's actually dangerous to keep it that high. And when Doug Ford was confronted about it and why he was making these people also sign non-disclosure agreements, why would you want to sign, and asking why would you make experts that are supposed to be just telling us what's going on sign non-disclosure agreements if they're just telling us how to stay safe? And Doug Ford said, I'm the most transparent person in the world. If you want to listen to how transparent I am, I come out every day at 1:00 and give a press briefing. So come to my press briefing and you'll see how transparent I am. So it didn't fix. These experts still ended up having to sign non-disclosure agreements, and there was no more transparency. So none of the problems actually get fixed, even when they're exposed to the public. And so the problems end up continuing. So for example, the 100,000 elastomeric respirators, because journalists didn't know that these respirators were recommended. Most people don't know that there's healthcare worker versions. And they also don't know that the Ontario government has had enough elastomeric respirators since June to protect 4 out of 5 healthcare workers in Ontario with their own. So we could have actually stopped so much of the spread in the second wave in Ontario in September. And by giving 4 to 5 healthcare workers an elastomeric respirator, that would also greatly increase the N95 supply for the other 1 in 5 healthcare workers that would rather have an N95. But once people are properly trained on elastomeric respirators, they tend to prefer to stick to the elastomeric respirator and don't want to go back to N95. So a lot of companies also have millions available. There's some Canadian companies that can make $1 million per month. So supply is not a problem, but that's another excuse, is we shouldn't be recommending them to the general public or to places like meat plants because it would take away from healthcare workers. Well, first of all, there's enough for a lot of healthcare workers right now, but they're not using it. And secondly, there's enough for everybody. It doesn't have to be just for one group. These manufacturers have enough in Canada alone to protect every Canadian with their own elastomeric respirators, but they're slowing down production because the government's not doing anything to actually promote their use, promote their recommendations, and there's still so much misinformation out there. Some of the news organizations like CTV News and CBC have actually had articles about how we should avoid using any respirator with a valve because it would be dangerous. And they cited information that was left on the Ontario government and the Canadian government websites as evidence. And this is contrary to elastomeric respirators because a lot of them do have valves, but a lot of the newer versions also don't have valves at all. But people assume that they all have valves. So they say we can't use them because they all have valves and therefore they're all dangerous. When the valve problem itself is also another misunderstanding. The CDC has actually come out with several studies to show that the exhalation valve is not dangerous and that there's more dangers coming out of a surgical mask, which is what is commonly used, than would come out of an exhalation valve. And that's if the exhalation valve is not covered at all, but they now recommend covering the exhalation valve if you worry about spreading the infection to others with a cloth or surgical mask. So we could easily protect every single Canadian worker so people could return to work safely and not have to worry about the virus. So we don't have to focus on just either the economy or stopping the spread of the virus. We can do it together. We could protect the economy and the lives of every Canadian. We just have to let them know the truth. So the public is still being told not just to wear a cloth mask now, but to wear 2 cloth masks because one is now suddenly not safe enough. But what the government should be saying is, cloth masks don't work. Surgical masks work with the right filter material, but you need a mask brace. So what the government should be recommending is surgical masks with a mask brace to form a full seal, an N95 or an elastomeric respirator, any of those 3 options. But those should be the minimum options. But right now, we're not seeing even N95s in common use. And we're actually seeing surgical masks by healthcare workers, even though a year ago, the government admitted that they knew surgical masks would not protect healthcare workers. It would only prevent them from giving the virus from somebody else. But if you use common sense, if the biggest demographic of people that are getting infected are healthcare workers, and they represent 1 in 4 people, then we should be looking at how we can prevent them from being infected. If we have a tool that we know protects them and potentially exposes patients, we should be giving patients the surgical masks if they did think surgical masks were effective, and then give the healthcare workers the elastomeric respirators, even if it did have the danger, which it doesn't. But they're more concerned about the optics. So they're more concerned about staying with the status quo than changing things. Even in Quebec, about a month ago, a Quebec judge criticized the Quebec government because the Quebec government, they misled the public. They knew that surgical masks weren't effective. They knew that there was airborne transmission, and they lied. And then they even tried to use so-called experts in court that the judge ended up getting pissed off with because they didn't know basic information, and they were supposed to be experts. And now, so because of that court ruling, N95s are going to be used at a minimum in most of Quebec. But now, last week, 109 so-called experts said we shouldn't be giving N95s to healthcare workers in Quebec because it could cause fatigue, and there's a supply shortage, so there's not enough N95s. So it goes again with the lack of communication. A lot of the groups, they do great work, but they should be working together instead of working separately. Because sometimes their work goes against the work of the other groups, even though they're trying to help other people out. And if things like the healthcare unions would have let the public know that they've been fighting for elastomeric respirators and the government's refusing to distribute them, just the fact that they would be bringing that up, it would get journalists' attention. So journalists would know, okay, if there's other things besides N95s, why aren't we using this a year after they've been recommended if they're readily available and better than what we currently have? And it would also help other unions, like the postal union would have greatly benefited from knowing they could protect postal workers at their plants from these respirators, and they're federal employees. So the federal government could easily afford to buy these respirators and give them to all postal workers, so there would be no longer outbreaks at the plants. For example, the one that happened in Toronto not too long ago, where hundreds of postal employees, even places like Amazon would know how to use them. And then food plant unions would be able to know to give them to their workers, so there'd be no problem with food plants. So if we could prevent things like outbreaks at food plants, that means we also help protect things like the food supply in Canada. Because every time big plants like these close down, they'll close down for weeks at a time. They euthanize a lot of the animals, and the meat is just wasted. And then there's a meat shortage. Prices increase for everybody else. So it's harder for everybody else to afford meat if you can end up finding it. And then these companies end up losing millions of dollars, and jobs are also lost. But if they would have used, let's say 1,000 employees work at these plants, elastomeric respirators start at $15. So for a $15,000 investment, Cargill could have saved themselves millions of dollars. And also you have to look at the publicity. So they got a lot of bad publicity from it. And then their workers are like, okay, well, we don't feel protected, so maybe this is not the industry for us, or it's not the employer for us. But these employers could protect their workforce. They could protect their operations. They could even in other places like tourism and things like that, airports could start using them, because right now a lot of people are just using cloth masks, and it'll still transmit the virus to others. And if people, like, let's say border control people, which talk to thousands of people on a daily basis, if they were wearing a cloth mask and became infected, they couldn't spread it to others, especially if they don't know that they're asymptomatic. But if we could protect them with N95s or elastomeric respirators, that means all those people going through the airport, they won't be spreading it to these airport employees or catching it from them. And then sometimes it's great when you're traveling that you do a test before landing and while landing, but what if you get infected while you're traveling? So that's a big issue as well. And a big problem with the virus is people are only focusing, oh, it's only going to kill 1 in 100 people or 1 in 50 people. But the reality is it has much more devastating effect than that. It actually has quite a bit of long-term effect. There's quite a few studies. There's a study with 235,000 Americans where it shows that 1 in 3 of Americans that had COVID, they now have brain issues. There's also a great study from the United Kingdom, which shows that with 48,000, which shows a lot of long-term effects, including lung damage, which was seen in 30% of the people, and other big studies where there's heart damage. Dr. Anthony Fauci talked about 2 great studies in while testifying in the Senate in October. And he said there's one where it was the NCAA, where their elite athletes caught COVID, and they ended up testing them with cardiac MRI machines, and 1/3 had signs of heart inflammation or myocarditis. And there's another study that was in JAMA from Germany where 100 patients that had COVID were tested, and 78% had heart issues, and 2/3 had heart inflammation. So that might not necessarily be the numbers in the average population, but when you combine things like heart problems, lung problems, brain problems, kidney problems, and things like that, it could lead to a devastating effect to the healthcare industry, our critical and essential workers like police officers, firefighters, paramedics, all the people we rely on to in the grocery stores and supply chains, manufacturing, all these essential people. A lot of them might end up being put on disability, or it's going to create a worse effect on the Canadian economy, because instead of being able to make money and give taxes, we're going to have to support them, and we're going to have to support them because of our negligence to simply not provide them with proper $15 respirators. So it's a $1 billion problem, or it's a $1 trillion problem, actually. Like in the States, they just spent $2 trillion to send checks, when to give every single American their own elastomeric respirator, it would only be about $2 billion. And if you were going to give one to every healthcare worker in the States, which is 18 million, it would cost about $275 million. And it would solve a lot of these issues. And by greatly reducing spread, so if we reduce 1 in 5 cases among healthcare workers, they're also not spreading it to patients in hospital, to residents in long-term care, to their families as well. Because the problem is sometimes healthcare workers get infected and they spread it to their kids or their parents or their partners, and then their partners get sick. And some of them have actually died because of that as well. And some of them have also had strokes. So I've heard about a nurse who got COVID and then had a stroke, another nurse who got COVID and then her husband ended up catching it and he died because of it. So it's causing a lot of mental health issues among healthcare workers and even general population, because they know that these masks are around. They know that they're better. They know that what they're using right now isn't working, and they keep screaming for help, but nobody's listening to them. Everyone's ignoring healthcare workers. Even sometimes when unions are talking about things, they only mention N95s. They focus only on one solution, N95s. And most unions in Canada only talk about needing N95s and completely ignore to ever talk about elastomeric respirators. And then because unions don't talk about elastomeric respirators, politicians and journalists see it as a sign. Well, if unions aren't asking for them and they're readily available by the government, and they're not asking journalists to help confront and pressure the government to distribute them, obviously they can't be that useful. So why would we waste our resources to investigate when the unions don't care enough to even ask for help? And unions are known to ask for help whenever they need it. So why would they not even use social media? So they don't tweet about needing elastomeric respirators. They don't even post on Facebook. The only Facebook post that I've seen on elastomeric respirators was a week before the Ontario Nursing Association had their annual meeting where they voted for the new leaders. And I was actually criticizing the union for not letting people know about the respirators. And I was saying people that vote for their leaders should ask their leaders why they have refused to ask for help, when politicians have said they would gladly help as long as unions ask for help. And that the journalists have said also that because they're not asking for help as well. And then that didn't lead to unions asking for help. That led to a post saying, oh, the ONA really thinks elastomeric respirators are useful. We really need them for healthcare workers. They're better than N95s. They're reusable. And that was it. So it's more about damage control than it is to actually promote awareness around these respirators. And because there's so much misinformation and a lack of awareness, people just make assumptions. And because some of these statements are coming from politicians and health agencies, they assume that if the government says it, it must be a fact or it must be true. And they don't actually look further than what the government has said.
On that point, and again, it's like you thought about this a few times. You've talked about masks before. You can just go off and yeah, you just have everything to offer on this. But I on those last points you're making now, like I can understand with the average person in the general public. Like everybody has lives. They have dogs and cats and jobs and well, not recreational sports teams anymore, and kids and everything that they have to do. Like most people have a extremely finite amount of time that they can invest into the pandemic and any sort of auxiliary research on their own accord, and rightfully so, they're dependent on what the CBC and the major papers and the federal and provincial governments have to say. Like that's where you should be getting your information from. And, that is a reasonable thing to just go look into. So for most people, like you just want to know what's going on, well, just follow what's going on there, and that should be where you're getting the best advice. Unfortunately, that's not the case. But like with the press, like how come they really have this strong of an aversion of looking into this deeper? Like, just because their job is to look into what the government is doing, whether it's right or wrong, and that is the main point of their job, is to question what is going on and to look into it further. And it seems like bizarro world that the press is going to go, oh well, the government is saying this and they're not talking about this. So if they're not talking about this, there's no way that we could be looking into that. That is just the opposite of what they should be doing. And you said you've had some press contact, and there is some noise being made about it now. But like, what's going on with the papers and the public broadcaster? And if you have any knowledge about the United States as well, why isn't there more press coverage on this in the U.S.? Like, what's going on to where the press say, oh well, the chief medical health officers and the main politicians aren't saying this, so no need to worry.
So I'll start off with Canada, because Canada and the US is slightly different, although they're pretty similar. So when I first got the government to look into these respirators a little bit over a year ago, when I spoke to politicians, or not politicians, sorry, to journalists, they would say, oh, this is a great story. We'll look into it once the government actually approves and recommends them. And once the government approved and recommended them, all they did was update a website on Ontario Health to start recommending elastomeric respirators, but they refused to speak to journalists or anybody. So they didn't even confirm that they made these recommendations. So back in June, I had CBC and Sudbury. They were gonna. I asked them to look into these respirators because it had been approved by Ontario for over a month, and it had just been approved by Health Canada. And this was at the time where firefighters in Mississauga were saying, we ran out of N95s. We're now using our 40-pound SCBAs to every single call, and it's really cumbersome. It's really hard to do, and we really need the government help. And the government was refusing to help, or refusing to let them know. And because I knew other firefighters, like the ones in Winnipeg, had been using them, I knew the ones in Mississauga could easily use them. So I did a couple of things. First, I talked to the Mississauga Firefighter Association to let them know. And they ended up getting some of these elastomeric respirators after I spoke to them. But then I spoke to the CBC in Sudbury, and there was a CBC journalist, Kate Rutherford, was assigned to the story. So she ended up asking me questions for about 20 minutes, and then we did another 25 minutes of a recorded interview after she switched our call to the Sudbury studio. And then after the conversation, she said Marcus Schwabe, the CBC Sudbury morning host, would end up calling me for a live interview, and she just needed to confirm with the government that they were recommending them. And part of the story was that the government was refusing to admit that they had recommended them. So I waited for 4 weeks, and then Kate Rutherford let me know that she had spent 4 weeks to email and call the government to ask them if they had officially approved and recommended them. And she said since the government refused to get back to her, she couldn't write a story about the government refusing to let the public know about this. Now, I also offered, because I've been working with experts in the US, Canada, and around the world, I also offered like different experts. And at the time I was talking a little bit with Tom Frieden, the former CDC director, and I thought like other great people would be able to be interviewed. So I offered these people. I said I could talk to these people and get them to be interviewed by you, because it was under CDC Director Tom Frieden that they were first looking into elastomeric respirators to protect Americans. And Kate said, "No, we have to focus on Ontario only. I'm not going to interview anybody outside Ontario." And I said, "Okay, well, I worked with Fashina. She can confirm that they've been approved and recommended." And Kate said, "Well, we often talk to Foss. I'll think about reaching out to her," but the CBC never did. So that story ended up, and that interview has still yet to air. And then in July, after I presented to I presented to politicians in an Ontario parliamentary committee on the effects of COVID-19 on different industries. I explained how using things like N95s and elastomeric respirators could greatly reduce the virus by about 30 to 60% by protecting places like food plants, healthcare workers, even in the travel industry. I explained different industries, how it can solve the problems and the amount of money it would return and why it would return that kind of money. Now, these politicians didn't understand anything about elastomeric respirators, so it kind of went over their head. But I ended up criticizing the CBC a little bit for refusing to do a story on the government refusing to let the public know about these recommendations because they weren't answering their call. In what other situation would a large news organization accept the fact that they're simply refusing to answer a question to let them get away with whatever they're looking into? And because of that criticism, Judy Trin, who I spoke to in June about investigating as well, who it works for the CBC in the Fifth Estate, she said she suddenly had time after my criticism to help out. So I was able to get some of the top experts to agree to be interviewed. I had Simon Smith, who's the chair of the Canadian Bioaerosols Committee. He was retired from 3M, but he was responsible for a lot of 3M's designs and manufacturing of elastomeric respirators and filters. And he's one of the top global experts on the science, and he's helped a lot of the manufacturers in Canada and the US. And he's often consulted by the CDC and NIOSH. And he's such a knowledgeable person. And then I also was able to get Kevin Hedges, Dr. Kevin Hedges, who works for the Occupational Health Clinics for Ontario Workers, and he's also the president of Workplace Health Without Borders. He is very familiar with elastomeric respirators and how we prevent infections as well. And they were both going to give interviews at the same time. So what ended up happening is the first time they were supposed to give the interview, Judy Trin let them know about half an hour before that she had to cancel. She was going to go from Ottawa to Toronto for another story, and she'd rescheduled the next week. And then when they were supposed to do the interview the next week, that interview didn't happen. And only after she missed the interview did she let them know, you know what, I'm working on a documentary. I won't have time to investigate this at all, but I'll pass on the information to Emily Chung, another CBC reporter, and she'll contact you. That was in August, and we've yet to be contacted, even though I sent several emails. And then I've also had other experts, for example, the Allegheny Health Network, which was the one that tested thousands of healthcare workers. I had, I believe it was their vice president of the Allegheny Health Network. And right now I even had the head researcher of that program, I believe his name is Sri Shalakonda, agreed to give interviews as well. But a lot of the experts, since the CBC canceled at the last minute, nothing happened. So I also had in the States, for example, Chris Hamby from the New York Times. He wrote a great piece in May about how everybody was overlooking these respirators despite how good they were and how they were recommended by the CDC for years. And how he even said how when he tried to get answers from the different agencies about why they were refusing to promote their use and let anybody know they were recommended, they just tried to pass the buck and they just tried to blame each agency. So we didn't actually get anywhere. And when I talked to Chris, he said he would love to cover the Canadian story as well because it would be a great story. And the only thing he was waiting on was an official acknowledgement by the Canadian government. So the politicians I had worked with, I had asked, and I said, you know, because mining companies assume they're dangerous and they're not, and they don't know that they're not recommended because the government hasn't officially let anybody know they're recommended. People are overlooking them and making weird assumptions like they're dangerous. And so many people would learn about this because the New York Times could suddenly cover this entire problem in Canada, and it would quickly blow up. And then before the start of the second wave, we would know how we could protect all our Canadian workers, and we could start to develop a great solution. Because at that time, some N95s were being used for months at a time, even though they're only made for minutes to hours. So it was a really dangerous situation. But nothing really happened in Canada. And it wasn't until late November that I was able to get a Sudbury journalist to write just an article about the Ontario health recommendations to use these respirators in the government stockpile. But she interviewed MP Carol Hughes, and Carol spread more misinformation about the respirators being impossible to communicate through and that they were dangerous for patients. When I emailed Carol, she let me know that it wasn't worth letting anybody know she made mistakes and that they were safe and not impossible to communicate through, because she made the assumption, she said she was assuming that there was no longer a PPE shortage in Canada, so it wouldn't be worth saying that there was mistakes or anything like that. even though months later she ended up promoting an N95 manufacturer from her riding as ways we can protect people for Canadians. And then a couple of weeks after that article, that did get the attention of Radio-Canada and a French journalist, Jean-Louis Dudal. And he interviewed myself, Michael Hurley, QP leader, and also the president of the Ontario Nursing Association. So Michael Hurley, in his interview, he even said one of the biggest reasons the virus is spreading so easily in long-term care environments is because healthcare workers are actively being prevented from using these respirators. Or either told it's too dangerous or not necessary, and that surgical masks are good enough. And even the ONA, they said that there's no benefit to warehousing them, but there is a great benefit to using them. But those were, and the only reason the ONA agreed to that interview was because I ended up getting the journalist to reach out to them. But the ONA CEO, Bev Mathers, told me in November, it wasn't worth for the union to speak about elastomeric respirators because they want to focus on N95s. But if journalists would go to them, they would answer. But they wouldn't actually use any of their resources to talk about them, to talk about it on social media, to ask politicians for help, or to even raise awareness on Twitter and Facebook and speak to journalists. So there's quite a few lost opportunities here as well. Now in the States, there has been quite a bit more news articles about elastomeric respirators, but the first news article, for example, was in February of 2020. Tom Frieden, the CDC director, wrote an article for CNN, and he said, with the pandemic, there would be an inevitable N95 shortage, and the only way to solve that would be to switching it to using elastomeric respirators. And then on April 3rd, the USA Today had a great article where they said, where Tom Frieden was also interviewed for it, and they were criticizing the US government because in 2018, the CDC had recommended the Trump administration to stockpile elastomeric respirators for any future pandemics. But Trump decided to gamble and say, we're not going to have a pandemic on my term. We're not going to invest a little bit of money to prevent pandemics because there's not going to be a pandemic on my term. And so that ended up being another problem because the US government didn't also in the future want to admit that these respirators were safe, because then all these questions during an election cycle would be, well, why did you refuse to stockpile them in 2018 and why haven't you used them during the entire time? But at the time, the US administration was saying the virus would quickly disappear when the summer happened. The virus would quickly go away and it would only be a matter of weeks. So we didn't even need N95s or anything like that. And at first they weren't even recommending PPE at all. And then they were saying, oh, we're now recommending PPE, and we weren't recommending it before because we didn't think there'd be enough for healthcare workers. So there's been a lack of transparency. And then after that, there was a New York Times article in May about how they were overlooked. And then there's a few smaller news articles about them as well. Not very many major news organizations have talked about them. But in February of 2021, so just a couple months ago, CBS News, CNN, and Washington Post had a few of the experts I'm working with trying to sorry, I'm going to have to look up his name so I don't mispronounce his name. But Devab Haktuni Sri Krishna is one of the great experts I've been working with for quite a while. And he's wrote some articles for CNN, CBS News, and Washington Post, and he's also been interviewed. And he explained that a great way to solve the US administration's 100-day challenge to stop the pandemic, a lot of the experts are now saying, is to put N95s into widespread use. But he also went one step further and said, not just N95s, we should put elastomeric respirators and N95s into widespread use. There's no reason we can't. People just need to know how to use them, that they need to be fit tested and to be and to receive some quick training. And that unfortunately didn't really get picked up because these news organizations don't really know much about elastomeric respirators. And when elastomeric respirators are mentioned, they're often mentioned as a secondary part of the article and not as like the main part of the article. So it's easy to overlook them. And I've actually been saying since last year, and even in the parliament, that's why I said, if we put widespread use of N95s and elastomeric respirators to protect our workers, we can keep our economy open. We will never have to shut it down again. And we can significantly cut down the cases at the same time. So we'll save our country billions of dollars. We'll save all the citizens from having to suffer from this disease, from having to die, from having to lose loved ones, or from having to suffer the long-term effects. I got sick I got really sick back in March of last year, and I'm still suffering lung issues from being sick of last year. So I can understand all these people that are afraid of catching the virus and things like that. And I don't want anybody else to suffer the way I suffered. I don't want anybody else to have to say goodbye to their wife or husband, to their children, to their parents, or to their loved ones. And even people in long-term care homes, we're neglecting the residents in long-term care homes because we don't know how to properly protect them. So even the ones that are fully vaccinated, they're still often being locked up in their rooms. There was no real proper program to stop infection. So when there's rooms with 4 people that stay in a room, if one person's infected, the other people eventually get infected, but they kept them in the same room. So it was just a matter of time before the virus would quickly spread through long-term care environment, which is why it created so much damage in Canada. And also on top of that, when you look at the staff aren't getting proper protection. So when they're given surgical masks or cloth masks, they're getting infected, and then they're spreading it to the patients as well. And then they could spread it to the patient, and the patient could spread it to a secondary healthcare worker or other people. So we could quickly stop the spread in its tracks. We don't have to let it continue. It's easy to prevent it, but we just have to admit what the science is telling us and what the data is telling us.
Yeah. And yeah, there's a lot of stuff on the health aspect, and the cost in it's actually the cost is actually a lot larger than you've even entailed. But I'll get to that. But just back to the point on the press. So from what you outlined, it seems that that there's been still inadequate, but a lot more going on in the United States than here.
Mhm.
And what's been weird is, ever since early on, to about a year ago, and I think the concerns didn't really start coming in until early April, late March last year. But the idea that, just like what we've seen with electoral campaigns and whatever, like, social media has an unreliable aspect, and there's some sort of incentive structure for bad actors, and so we're going to be just bombarded with this tsunami of misinformation and conspiracy theories and what have you. So and really, until communicating with you, and I have seen it at times, like one of our biggest political writers in our country, Paul Wells, for Maclean's, he went on CBC one time, there's on one of those stupid talking heads shows, and he just stated on CBC that the CBC is being the mouthpiece of the government. And after a point, that's really what it seemed like. And there's some of the big commentators with CBC, and I'm apologizing to all the non-Canadians out there for me talking about too many Canadian reporters, but like you see like the sycophancy with people like Rosemary Barton. And so it was obviously an issue, but as the pandemic has gone on and on with the CBC, it's really being a critical issue. But I didn't know how much of a problem it was until talking to you. With the social media companies, it did seem to be a problem early on, where they'll only report what the official government agencies are reporting, and there was a facade created around it where it's like it's to protect you, and we're protecting you from only this type of misinformation, and so, but it's the people in the public health agencies working with governments, they're not omniscient and they're not infallible, but we had to play along with that. And it's caused a whole bunch of issues. As you're outlining, this very understated problem with specific masks and respirators, but also the adjacent issue with people you've worked with and people I've talked to, this aerosol debate, which is also crazy. Like, digging into what's been going on there, it's unbelievable how much rot there is. So like so you have the social media companies, working with the governments, and in making sure that their message is only out. And on a personal basis, like when I look up stuff, about um, you know COVID being airborne or certain types of masks on Twitter. I don't go on Facebook anymore. That's just a hell pit of shit. But when I do it on Twitter, I just get bombarded with these lists of disclaimers. It just flies in my face, like, make sure you pay attention to what the government is saying, et cetera, et cetera, et cetera. Like we're not, I'm not going to go too ridiculous into this. It's not like there's this mass suppression where we can't discuss it. Obviously you and I are having this conversation, and you've had tons of conversations with other people, and the what seems to be, from my vantage point, that the proper side of the aerosol debate is really getting a lot of steam right now. And so it's not some sort of mass repression of information, but there has been some of that, and it is somewhat anathema to liberal society. And so do you think after things slow down, do you think that there is a chance that there might be some sort of reckoning with the press? Like, obviously they're going to try to work around it so that the massive mistakes that they made with and the cost that is accrued as a result of those mistakes, they're not going to want that to see too much daylight. But like, there should be some sort of reckoning with what the press has done, where really going out of their way to only focus what is coming out of the provinces and Ottawa, and not alternative information from not some wingnut in a basement, but like actual professionals like yourself and scientists. Do you think there's any chance, maybe even now, like as I mentioned, like things are really turning with aerosols, but is there, do you think there is anything that could happen that is going to show how much the press has failed, and to ensure that they don't do something like this again, with not putting proper daylight on different information other than just what the government is putting out?
So a year ago, I would have said absolutely any big problem like that, it would lead to changes. But after a year of seeing all the changes that have yet to happen, I have lost faith a little bit in our system. But we have to ensure that our safeguards are in place. So we have to ensure our press is held to the highest standards possible. And we also have to ensure safeguards are put in place so any future problem, the weaknesses that we see exposed now are not ignored. So most of the people right now we see that are suffering are often minorities that are already suffering before the pandemic, and the government's taking shortcuts on their lives. So when it comes to things like mining industry and things like that, there's all these high regulations, and these are industries that have lots of men and often have lots of money coming in for the government. But when it comes to things like food plant workers or healthcare workers, where there's a lot of minorities working, we ignore the fact to protect them. So for the last year, the government's been arguing against unions to upgrade protections when so many people are dying. There'd be no other situation where thousands of workers would be dying from one problem, and we know there's a solution, but we're refusing to use that solution because we don't like it. So the press, we have to ensure that there's new ways to ensure that they can't ignore stories, and that there's maybe an independent process as well, and that there's a place where we can go as an alternative. We can't go to the normal places like CBC. Maybe there could be an independent nonprofit press that can expose some things that would have credibility. But we also have to ensure things like unions have safeguards as well. So unions are really great. Now, there have been great unions and there have been terrible unions. Now, even the terrible unions have done great things as well. But we have to make sure that things like in the future, if the government is refusing to upgrade protections for workers, unions have more power to bypass the government. So if the government's saying, okay, well, surgical masks are good enough, so we're not going to give you better protections, even though we've paid millions to have those better protections a year ago, the union should be able to say, you know what, we want to enact like emergency power, like that would only be used for emergencies, but we want the best protection for our workers. So we want N95s and we want elastomeric respirators. So we have to give unions a little bit more power as well, but we also have to ensure that our unions are accountable and transparent as well, because with the lack of transparency, it's hard to build that trust as well. And even with politicians, we have to ensure our politicians are held accountable. So right now, a lot of the times when you ask a politician a question when they're caught in a problem, they're not even going to answer your question. They're just going to deflect and say, well, somebody else did something wrong. Look at what they did, or I actually did way better than this person, and this was a great solution. And they'll never admit what they did is wrong or talk about what they did. They just kind of deflect. So we shouldn't be able to allow our politicians to simply get away and deflect. We should have a system where they are accountable and they do answer the questions and they can't avoid it. But the problem is right now, every party is afraid to admit they make mistakes. So nobody wants these kinds of protections because it would harm everybody. It would benefit society itself, but it would not be necessarily good for the politicians that like to maybe take shortcuts or like to take things that are better for them, but not better for their voters. So you saw a little bit with Doug Ford, the way he was closing things, it didn't really make sense. And even like all the big box stores and things like that, but shutting down the small businesses, that was terrible. It seems like anybody who lobbies the government gets favors, but anybody who doesn't have the right resources or money to lobby the government for favors, they're going to be abandoned and ignored. So you can see that with the manufacturers, PPE manufacturers. Everybody seems to be focused on 3M, and they only assume 3M makes N95s. They only think 3M makes elastomeric respirators, but there's dozens and dozens of manufacturers that create them. And some of our Canadian manufacturers have had 15 million N95s collecting dust, but because of political hurdles, they can't advertise it. They can't sell it to the hospitals. They can't sell it to the public. They have to sometimes get Health Canada approval, which could take months. And then after they get the Health Canada approval, you'd think that would be good enough. But then they say, no, you also need American NIOSH approval as well. And that could be an 8-month waiting list. And some of the times, if it makes it to the press and the public, for example, in January, there was a Quebec manufacturer, and that's exactly what happened. They were approved by Health Canada. They were the first elastomeric respirator approved in Canada without an exhalation valve. So it was a healthcare worker version. They were recommended by hospitals, and all the hospitals wanted them. And all of a sudden, the Quebec government said, no, you're going to have to wait till the US government allows for Canadians to resend their applications to NIOSH, and you're going to have to get approval. And it's all a bureaucratic process. But then the press and other great news organizations covered about it and said it's just a purely bureaucratic process. And 2 days later, the government decided, you know what, we'll give this company a pass because they're in the news. So if once there's public pressure, these politicians do make changes, but we have to be able to enact public pressure and find ways to put pressure on these politicians, because if they can avoid even talking about it or having that problem exposed, they'll bend over backwards to say that problem doesn't exist, or that it's a bad problem and it's not really a good solution. And the solutions that are currently being used that we do know don't work somehow work better than the things that they do know work. So there was a great article that came out in April of last year. That was the one where the Northern Ontario Business and Lindsay Kelly interviewed myself, Franchina, and Carol Hughes. And Franchina even said in the article, we know that surgical masks only protect the person. They don't protect the person wearing them, but they do protect those around the person wearing them, while N95s protect those wearing them and those around them, and elastomeric respirators protect those wearing them, but might not protect those around them. So she knew that what was currently being used, surgical masks, is not effective, and that we could protect healthcare workers with elastomeric respirators. And even in June, once the government bought 100,000, she even knew that they were better than N95s. And she knew that healthcare workers desperately needed N95s, and these were recommended as N95 alternatives. But for some reason, she'll go in Parliament and say how bad healthcare workers needed N95s and they're dying, we need to do everything. But she won't ask the government, won't say, well, Doug Ford, we have these N95 alternatives from 3M. Why don't we use these until we get more N95s? They're N95 alternatives. We know they work better than N95s most of the time as well. So why can't we at least use these instead of surgical masks until we get more N95s? So her goal wasn't necessarily to protect healthcare workers. Her goal was to criticize the government and make the government look bad. If she wanted to protect people, she would have at least told journalists that these respirators are being recommended and available, but that the government's refusing. And her excuse to me in July as to why she wouldn't criticize Ford was the assumption that healthcare workers would not want these respirators. And even in the US, back in September, I wrote a post on LinkedIn about the CDC being responsible for not letting the public know about the recommendations to use it. And John Podolsky, the White House COVID supply task force supply chain lead, he wrote publicly on my post, it's not the CDC's fault. Unions and associations don't want elastomeric respirators. So then I wrote back, well, what makes you think that? Because I have a post here from May where the president of the American National Nurses United, Zane Cortez, did a town hall with Linda Silas, the Canadian president of the Canadian National Federation of Nurses. And I asked in May of last year why they were not using elastomeric respirators. And Zane said, our hospitals in the US do have these a little bit, but hospitals are locking them up because they say we need to save them for future waves. And Zane even said, it doesn't make sense. Our nurses are dying right now. We had a nurse go in that had a COVID patient, had a code blue, I think it was called, and she had to rush in and save them. So the N95s were locked up as well, and lock and key. So she didn't have time to find staff at the other side of the hospital with the key to get an N95 while her patient was coding and having a heart attack. She had to rush in the room because the healthcare workers, they put their patients first. So they rushed in, she got infected, and then she died 10 days later. And these respirators are reusable. So there's no excuse to, we'll just lock them up for future waves. We could use them now and in the future. So, and then there's also one of the largest, the Communication Workers Association, which has 700,000 members. Back in May as well, they put out a statement saying that their union members should start looking at elastomeric respirators, and that they want the White House to start asking manufacturers to make more of them, because they didn't know at the time that there was quite a few available. They assumed, like most people do, only 3M is available. So if there's a shortage of 3M, it must be everywhere. Mm-hmm. So they have been wanting them. And after I said that, and I provided proof, and then also other unions like the New York State Nurses Association, Pat Kane and others have nonstop asked for the government of New York and the federal government to use elastomeric respirators. And there's great advocates like Jumani Williams, I believe his name, and he's been helping these unions try and get elastomeric respirators as well. But nobody's listening to these unions. So these unions are being ignored, and people often don't know what to make of these respirators because they'll hear from the government, they're dangerous, or they're impossible to communicate with, or all kinds of excuses that don't stand up to scrutiny once you actually research them. But they assume the misinformation is fact. And since the government has yet to even share a press briefing in Canada or the US about their recommendations, people often don't even know they've been recommended for a year. So it's the biggest oversight of the entire pandemic, is to let the public assume that cloth masks would somehow keep them safe. And then when they find out it doesn't keep them safe, to say, okay, just use 2 of them or 3 of them, when we could be saying, use something that gives you 100% protection versus something that gives you 40% protection. So it's a biggest failure of the pandemic, and so many lives could have been saved. And even the economic impact, they could have saved so many jobs, so many businesses from having to close. And it's really the future of pandemics, because some hospitals in 2009 used them for H1N1, stored them for 10 years, and then took them out 10 years later for this pandemic. And most people don't even realize that elastomeric respirators and N95s were first used at the same time in the mid-90s. The reason N95s were used is because healthcare workers were starting to be infected with drug-resistant tuberculosis. So the US government was looking at ways to protect their healthcare workers from the tuberculosis. So hospitals that wouldn't necessarily see them very often were given these disposable N95s. But then hospitals like the Texas Center for Infectious Diseases, which saw infectious patients on a daily basis, they needed a more sustainable solution. So they've been using elastomeric respirators that entire time. And there's so much misinformation that sometimes even I think it's changed now, but I've seen a government website from Health Canada say to change the filter on a daily basis. But you actually don't change the filter on a daily basis. Like the Texas Center for Infectious Diseases, In hospitals, especially where it's a sterile environment and you don't have to worry about dust, they actually just change them out once a year. So they set up a date, and let's say it's May 1st. So you got a new filter on May 1st. May 1st the next year, you're going to get a new filter. But if it gets damaged or soiled or clogged, then you'll get a new one before then. But these filters are good for years at a time as well. And we're more sticking to N95s for familiarity because back in SARS and H1N1, the pandemic didn't stretch out as long as it did, and it didn't spread as quickly to as many people either. So it was easy to get away with N95s, and that's what became familiar to everybody. So it's more being used out of familiarity now than it is necessarily about being the best option. And that's why often you'll now hear from experts or unions N95s at a minimum. Because while N95s are good and the government says they're the end all solution, they're actually just the minimum level of acceptable PPE. And we should be going to N95s and elastomeric respirators, PAPRs, and other solutions as well. So PAPRs, powered air purifying respirators, are also great options, although those can cost a couple $1,000s. So they might not necessarily, and they're harder to mass produce. While elastomeric respirators are easy to mass produce, and in Canada, we can make millions, millions per month. And some manufacturers can make $1 million per month per mold. So if there was actually um, more demand for them, like if the government let these businesses know to use them, they could start introducing more molds. So instead of 1 million per month, they can make 5 or 10 million per month, and then supply every single Canadian within a matter of weeks or a month, and then also start helping out in other countries. Right now, there's two great associations of PPE manufacturers that have formed to try and get over the hurdles put in place by the government. One is an American one called AMA, the American Mask Manufacturers Association, with the president of Lloyd Armbrust, and that was formed in late February with over 50 US manufacturers. And they also wrote a letter on March 1st to President Biden and others, and to let the government know that there was so much PPE available that every American could have PPE. Currently in their warehouses, they had, I believe, about 300 million N95, millions of elastomeric respirators, and hundreds of millions of surgical masks with mask bracers. And then their monthly capacity was about 300 million N95s as well, and millions of elastomeric respirators and hundreds of millions of surgical masks as well. So it took about 5 weeks, but then the FDA and the government finally said there's no longer a PPE shortage. Hospitals need to stop reusing N95s immediately, need to switch to elastomeric respirators. The US government is currently looking at buying 375,000 healthcare worker versions of elastomeric respirators by several companies, and that businesses like food plants and other high-risk areas should switch to N95s and elastomeric respirators as well. That was done on the FDA website, and they sent letters out to the hospitals. So again, that's going to be something that's going to be overlooked by most, including news organizations, because it's 2021, it's not 1921. So letters aren't effective. What's effective is a televised press briefing by the president or the CDC director or the FDA director saying, we made these major changes. There's no longer a PPE shortage. So what that would have done is being like Google, Facebook, okay, that means we don't have to ban PPE advertisers anymore. So that means the PPE, people will know where to get PPE, all the options available, all the new types of respirators available. It would also mean hospitals would know to immediately stop reusing N95s. Long-term care homes would immediately stop using N95s, would realize there's other options. And the food plants and businesses that could benefit from them as well would use them. And the US government knows full well the benefits of elastomeric respirators, because in mid-March, OSHA, the federal workplace agency, told their COVID workplace inspectors that in hospitals, long-term care homes, morgues, schools, food plants, manufacturing facilities, and businesses, the risk of COVID was so high they had to stop using N95s and actually had to switch to elastomeric respirators. But these are the same workplaces where the US government is still telling the employees that work there for 8 to 12 hours a day that their cloth masks are safe, but their inspectors that are going there for 5 minutes or an hour have to use elastomeric respirators because their N95s are not safe enough. So it shows that the government knows full well the value and the impact these respirators would have, but they're choosing to only selectively share that information with groups that will not necessarily talk to journalists or talk to the public about them. So these problems will continue to happen.
Oh, well, it seems that some things are at least getting better in the U.S. But you mentioned so the filters can last for a year or years, you said, right?
Mhm.
Okay. And how much do these filters cost?
They cost typically between $2 and $7.
Okay. So you buy the mask. We'll talk about how much those cost, and as we had a discussion before, it can be marginal. So you buy the mask, and you only let's say let's move it actually. Let's say you change the filters out every 6 months.
Mhm.
Let's just say that. Okay. Not only is that, if you're using a mask on a regular basis, not only is that less of a cost than N95s, because those you got to check out every day. Some environments less than that, and those are going to be like I buy a box of 20 of the crappier KN95s from Costco, and Costco prices in a 20 pack, and they're still $1 in each. N95s are much more. So not only is this going to be way less of a cost on the company or the individual, or the government coffers, because in public environments they're going to be front the bill, but this is going to be less of a cost than surgical masks
Yeah, and it's also better for the
per
environment as
individual.
well. And it's
Yeah,
also
of course, that's a huge issue. Like it's starting to get bad now. Like I'm out in the sticks in rural Saskatchewan, and I'm starting to see the bloody blue masks around everywhere. It's a gong show, and not only in having more waste, or litter, I should say, accumulating around. Like most of the masks that, when people are done, don't end up on the street, they end up somewhere, but that is still just so much more unnecessary waste getting thrown into our landfills, which doesn't need to happen. So yeah, it's much more environmentally friendly, which is very, very important. But it, it's unbelievable, because this is, somebody might see one of these masks and be like, well, that's not practical from an economic perspective for each individual, but it's the most
yeah.
economically wise thing for any individual.
And some people might even have them already in their homes, so they don't even need to buy any. So these are actually commonly used in mining and construction and home
Yeah.
renovations. So a lot of people, if they do their own home renovations, or they're in the mining or construction industry or anything like that, or even painting, they'll have them in their garages or sheds or basement, or they might have a buddy that has one. So
Yeah.
I live in Sudbury, and Sudbury is a big mining community. And at the smelters, some of the smelters I worked at, there's thousands of workers, and every single worker has to have an elastomeric respirator on them to even step on the property. And like sometimes it's a half face version, or sometimes it's like a full face version. But they bring them home. So these people, all these thousands, and that's just at one smelter. And there's two smelters in Sudbury, but then there's also mills and mine sites and things like that. So in
Yeah.
Sudbury alone, there could be like 20,000 people that have these in their homes already, which is probably about 1 in 8 people in Sudbury. So people might not even have to buy anything at all. People might even have these solutions already in their homes, although they're more likely going to be the industrial ones. So they might not be as good as like the newer ones created during the pandemic, but they're going to be way better than their cloth masks that they're using, and they're going to be better than the surgical masks that they're going to be using. And if the goal is to actually stay safe from the infection, then you should want to use something that will fully protect you. And that's something I didn't get with the excuse about we shouldn't give them to healthcare workers at first, because they thought they could potentially infect patients. The patients, first of all, could be the ones given the surgical mask, and the healthcare workers, which are the ones at highest risk, could have been given the elastomeric respirators. So it would have greatly cut out a large portion of the people that were getting infected. And on top of that, you have effects that are downstream effects as well, because hospitals, since there's so much infections by healthcare workers, that means they're canceling surgeries and procedures and things like testing for cancers. So about 6 months ago, there's a great news article. It was saying that cancer is down about 27% compared to the year before. Not that the cancer is actually down, but people aren't able to test for these
Screening.
cancers. Exactly.
Yeah.
So what that's going to result is, when the pandemic is over and when we finally do these tests, these cancers will have spread and will be harder to treat and cure. So people are going to have worse outcomes from their cancers. So cancers they might have, if they would have caught like they would have normally, they could have easily survived, but a lot more people are going to die, or a lot of people are going to be very ill. And even things like other like children's surgery. So there's a great article from Sick Kids in Toronto where it said 2/3 of children have missed their operating window. So during their growth cycle as kids, they can only be operating on a certain amount of time to, let's say, fix a cleft palate or other issues that could easily be fixed. But if it's not fixed, it'll lead to lifelong problems. And because these hospitals are overrun, we have to cancel all these surgeries. So these children are going to be living with these permanent disfigurations or all these problems for their life, when we could have easily protected the doctors in these hospitals, and then there'd be no spread in the hospitals. So it's not just little effects
or
here.
the general public too, so the people
Exactly.
don't end up in the hospitals.
Exactly. So and so even though supply is not an issue, some people have said they don't really need them in food plants. We should reserve for healthcare workers, but there's enough for both. And if you protect the healthcare, or sorry, if you protect the people at food plants, correctional facilities, and manufacturing and stuff like that, those people are not going to spread it to the community. So the workers and the community spread are not going to end up in the hospital to infect the healthcare workers. So that's an additional method to eliminate the spread in the hospital, because these less people would then become infected to potentially infect the healthcare workers treating them in the hospitals. So we could quickly help reduce, but it's like a chain, because since we're not breaking the cycle continues to spread. And then we also have these mutations. And because so many more people are being infected, it leads to the possibility of more mutations. And then things like vaccines aren't necessarily effective against all the mutations. So people can get reinfected. And the CDC just had a study that came out last week where, although I believe 200 million people in the US have been vaccinated, it showed 6,000 people were reinfected. And in other countries, and depending on the vaccines and other things like mutations, people have a higher possibility of reinfection. But then people say, if you're vaccinated, you don't have to wear a mask. You could take more risks. But then if these people are being reinfected, and also the vaccination reduces symptoms, that's going to mean the people that are vaccinated and do get reinfected are likely going to be asymptomatic spreaders. And because people make assumptions like, oh, they're vaccinated, it's not going to have, that person who caught it wouldn't have caught it from that vaccinated person. So we're going to miss a lot of the places where they're going to be also infected. So the CDC director, I believe, just a few weeks ago said, like, you don't even have to wear a mask sometimes if you're vaccinated and things like that. You can take all kinds of risks. But until the pandemic is over, we shouldn't take risks. We don't know exactly everything there is about this virus. We're learning everything. We know enough.
We don't know the risk distribution. We have no idea.
Exactly. And things change. Like, we're learning things every day, and we're not even using what we know to our advantage. We're ignoring a lot of what we know because it's inconvenient for the things we said in the past. And because it has to fit like a certain narrative, we try and get whatever is science and facts and then change it to fit a narrative instead of just saying the facts straight up. We have to change them to fit for whatever message we're trying to get across, even if it's not right or accurate. So if the public would have been told right away, for example, you do need masks, but the better one should be reserved for healthcare workers, instead of telling them you don't need masks because you didn't want them to take, it would have been better. But because they lied, the public is going to have a lot more trouble trusting the government with whatever they say in the future. Well, if you said cloth masks weren't essential at the start, why are you saying it now? And then if they say, well, if cloth masks are effective, and then they say double masking is effective, why would we suddenly trust now? If they finally do say elastomeric respirators are safe, why would we trust the government to say these respirators are safe when they repeatedly misled the public to believe things that weren't safe were safe? So it's a problem that just gets worse and worse and worse, and it could easily be solved by just being transparent with everyone.
Yeah, it's a tragic tale that they've taken over all of the messaging to protect us from misinformation, and then they end up being the one of the primary outlets of misinformation. It's just a complete nightmare. But you mentioned too, and this is what I've been talking about with people off the show, and very concerned about for some time, is, with another risk beyond, the virus itself, and the economic costs, like those are mounting, and that there's going to be, so many secondary risks and issues that we're going to be, fixing for the next decade at least. But we don't know how screwed we are with our healthcare system. Like, there's 1,800 surgeries just canceled in BC yesterday or something like that. And you mentioned all the issues with children. You mentioned cancer screening. We can go on for days. Like, how many people with early onset diabetes are like, well, I'm not feeling that great, but it's hard for me to get a doctor's appointment, and I don't want to go out. There's all sorts of things that are preventing people from going to the doctor. They're concerned about it's not a good time to go to the doctor, or they just can't. And so all these other diseases are accumulating and mounting. And so not only, let's even put aside like the humanitarian tar pit that's involved there. Like, these are all stacking up, and we're gonna have to deal with it later. And our healthcare system, before this, wasn't exactly robust. And now, after this, we just ran over it with a steamroller, and it's going to have to take on way more of a workload than it did before. We just don't know how much, and that's to discount, the suffering. Yeah. So there's this direct healthcare cost that is, we don't know how bad it's going to be. And, so much of this could have just been prevented with mask use, if this would have been implemented early on in conjunction with all the other measures. Because even if we did like a harder lockdown, we followed, like, if there was a lot of really strict measures in Ontario, and Doug Ford had this big initiative of uniting the province, and a lot of people even in the country were looking to him, because he had a lot of really emotional press conferences and stuff like that, and trying to shoot it straight with people. If they would have followed through with these harsh restrictions for a couple more weeks, and then followed up along with much better contact tracing and testing, like, that's also been like, everything has just sucked in Canada. Like, we haven't gotten anything right. It's just been bullshit all along the way. The vaccine rollout has been garbage. Contact tracing is dismal. Testing has just been a big argument and gong show. We can't get travel restrictions right. Airports have been a nightmare. And then masks are just an unmitigated catastrophe.
And then you have the border too, where you could just fly into an American town on the border and avoid all the restrictions. So all these rules that we're putting in place, we're leaving loopholes open so that these actually new rules won't actually have as great of an impact as we want, because people can easily avoid them.
Yeah, there was another story on that yesterday. Like, people are, instead of flying back from wherever, I'm assuming like Phoenix area, or at least that's where a lot of people in my neck of the woods go to down to, is usually Arizona. Maybe some people out east go to Florida more, or something else. But instead of flying back, they're like, oh well, we can actually circumvent the border quarantine measures if we drive through. I didn't know that. How the hell is that happening? It is just complete incompetence,
because their system is full of loopholes, and not just with the pandemic, but all the time. So there's always a way to avoid it if you know how to avoid it. And people will go to the airport, take a $200 cab, and walk across the border. And then we're surprised. But even if you look at, for example, that new mutation from India, it's a double mutation. We have known that there's all these people in India that are spreading it, and we kept letting flights in from India. So all of a sudden, I think we had our first case was announced only 3 days ago, where there was one in Quebec. But then the same day we announced it in Canada, there was 39 in BC.
Yeah.
and there was 11 flights from India within the last week. So we we should have closed any high risk places, like even the UK. We should have stopped flights from the UK when that strain came out, from the Brazil area. And then we also have to look at connecting flights, because that's another loophole. Okay, we might ban flights directly from India, Brazil, or UK, but if instead of flying out of Brazil, you just go to Argentina or a surrounding country, and you can avoid it altogether, it's not really going to have an effective control, because you can easily avoid it, just like the border crossing. So these mutations will still come in. We need a better system in place, and even letting people go out for their vacations. So we said only essential travel. So we saw it over the Christmas holidays, our politicians got caught doing traveling to the beach, which wasn't essential. So why don't, if it's essential, why don't we require, before having even a ticket to fly on the plane, getting some kind of pass by the government or doctor, or for whatever essential reason it is, before even being able to buy that ticket. But there's no system in place, so it's an honor system, and we know people aren't very honorable. They're just going to do whatever they think, because they don't think the virus is real, because sometimes it's our own politicians that said it's just a regular flu, don't be afraid of it, I got sick, it didn't do anything. So people then listen to their politicians or whatever team they're on, and then they take risks. So they're not necessarily honorable. Even people that are supposed to stay home, they'll go around town, have parties, especially you see the kids and stuff like that. And so we can't work by the honor system, because we don't have an honorable society. So we have to include that when we make recommendations. We have to realize people are going to try and break the rules, look for these loopholes. So we should we should not have loopholes. We should ensure that whatever we're looking to do, we have a system in place that people can't take advantage to bypass that system, because it's national security. So it might be one person allowed in, but if that person has a mutation or cases, and then it goes into somebody else and goes into community, that spreads inside Canada, and it could quickly spread across the country. So you saw with the variant in BC, like it's even affecting the Vancouver Canucks and the NHL. And even the NHL, if they would have known that they can maybe protect that cloth masks aren't effective, and to switch to N95s or elastomeric respirators, money is not an issue for these associations like the NHL. They make millions of dollars. The fact that they're having to postpone is costing them millions and millions of dollars, while to protect every single NHL player in Canada, staff and arena, it would have cost under $50,000. So if these people that are suffering know where they can go to prevent that suffering and to prevent the damage, we can stop so much of the spread, and it's not going to take a year to stop. We just need to let them know where to go to get these respirators. So we have to let them know all the manufacturers, not just 3M, but have a list. The Canadian and US government could easily have a website where it lists every single manufacturer of N95s and surgical masks. The government could easily hire somebody to call these manufacturers on a daily basis to say, how many N95s or elastomeric respirators do you have today? And then update that number on the website. So when people and businesses look for PPE, they just have to go on a government website, say, look, okay, if I want an N95, these 30 companies have N95s. Okay, these ones have N95s available. So I'll click on that one and get it from them. And that's an easy way to do it. And even things like the government could easily help. The government could easily provide free shipping for PPE for manufacturers. So when manufacturers are looking to send it to the public or to businesses, they could quickly ship it. And the cost for the government, for example, Canada Post, the Canadian government could easily bite that cost. And then the manufacturers can also reduce the price of their respirators, and because they don't have to worry about the shipping costs and things like that and logistics. So it'd be easier to get the PPE across Canada, across the US, to anywhere it goes. And there's so much PPE that the Canadian Association, CAPM, they told me a couple of days ago that they're going to be donating 1 million masks and surgical elastomeric respirators, and even kid sizes, and the filters as well, to St. Vincent in the Caribbean, to help not only with their COVID, but they have a problem with the volcano. So it's
Right.
not only the virus it helps with things like different gases that might be from the volcano. It helps with wildfire smoke. So if you're out in BC and you often have to breathe in smoke and you're asthmatic or things like that, you can easily use these respirators and not have to worry about hurting your lungs. And then even when it comes to the future, this is going to be a great solution. So people that have are immunocompromised or going through chemo or going through treatments, these respirators are going to be readily available in the hospital because the pandemic will be over. So we can loan these respirators for free to all these cancer patients, and they'll have better outcomes because since often they have no immune system, even a little common cold could easily kill them, or anything could kill them. So they can't, it's hard for them to interact with others, to go shopping, because they're afraid, they have no immune system. But if we can give them elastomeric respirators, they can go out and do grocery shopping, they can see their friends, they can see their doctors, and not have to worry about a simple virus killing them that everybody else would survive. So it's more than just the pandemic that these are going to be useful for. These are going to be useful for stopping pandemics in the future, helping people with climate change, because with climate change, there's so much more wildfires. You saw all the fires in Australia and Brazil last year, and all the fires in California, and that's going to be more common with all the climate change and the weather getting warmer and the forest getting drier. And it's going to help protect a lot of vulnerable populations. So anybody who has lung issues, COPD, asthma, or bronchitis or things like that, it's going to give them a more of a chance of survival for things like where they might breathe in smog or different things as well. And it's going to improve the lives of so many people around the world.
Yeah, it wouldn't hurt to have everybody having a high quality respirator kicking around. They can use it for so many things, and like you were talking about before, like a lot of people already do, and they should be utilizing it. Like I have a friend who's a construction supervisor, and he says he has one of the P100s, just always sitting in his back seat. I'm like, man, you should wear that at when you if you're going into a busy store, like after you're done work, because if you're doing your shopping after your shift, when it's the worst time for aerosol transmission in a big busy grocery store, like wear that thing. Now with the mass distribution, do you see anything that could possibly change soon? Because this is also a multifaceted uh, conundrum, because you have, not only do we need these masks out, but we have them. And also, like what just blew my mind early on in the pandemic, right off the bat, before like I'd even thought about elastomeric respirators and everything I've been finding out through you, is like I my initial thought was like, hey, we need tons of N95s, and the prime minister makes a new contract with Shanghai. And my immediate thought was, well, one of the biggest uh, um, industry vacuums that we've had in the country in my lifetime is the drying up of manufacturing in southern Ontario, places like
Mhm.
Windsor and London and Cambridge and Hamilton. It's like this is the perfect opportunity to put a shot in the arm of these industries and put some life back into that part of the country, the old manufacturing sector in Ontario. And but he's buying masks from China. And this is obvious, and it's even worse that I've found out the last little while through you, is that they were making masks, and there is this warehouse in bloody Cambridge that are packed full of masks, and then you've been telling me too that they're shutting down manufacturing because they just can't get them out, and they're just sitting there. It's a nightmare. So
Yeah,
is there anything that can change, you see in the near future, so that we can not only get these masks out, but have some necessary industry going on in that part of the country?
yeah. Well, we have ministers that are in charge of innovation and the economy and things like that. The these ministers should be working with the manufacturing industry. They've been asking for help. They've been trying to get a hold of the government, but the government has often said, for example, there's that new 3M facility in Brockville, I think, and the Canadian government ended up giving 23 million. The Ontario government gave 23 million uh, to the company just to help start the operation, because they said it would help make N95s in Canada. And then they signed a long-term contract. But then when other Canadian manufacturers that are being in Canada for 30 years and headquarters are just outside of Toronto, and they've offered healthcare worker versions of elastomeric respirators, and other manufacturers have offered N95s, the Canadian government said, no, you know what? We don't need your N95s because in 6 months, the facility in 3M we just invested in will start making N95s. So we're not going to be proactive. We're just going to hope that the N95s are going to be enough and that they come out in time. So what happened in December? 3M has said, no, it's still going to be months away. So those N95s didn't even come out till about 3 weeks ago. And a lot of other Canadian manufacturers did have N95s available during that time, did have elastomeric respirators during that time, but the government was only interested in 3M because they signed a long-term contract with 3M. So we need to ensure that there's competition as well. So some companies like 3M, they have great lobbyists and stuff like that, but then they get hospitals and they get the government to sign exclusive contracts to only buy from 3M. So when it comes to pandemic and 3M can't make enough N95s, and there's millions of other N95s available or better, but you can't buy them because you signed a contract saying you're only going to buy from the one company, which now can't even produce enough, then you're pretty much fucked. So there's so many manufacturers in the US. The AMA Association collectively, they've laid off over 2,000 workers and they've had to slow down their manufacturing, and several manufacturers have had to close down because they have no support whatsoever. And that's a huge issue because the US is even worse than Canada. The US, all the politicians in Canada, it's about made in the US, bring back manufacturing to the US. But when you actually look at it, they're buying most of their PPE from China. And it's because China could sell their PPE for $1 versus in the US, it's $1.25. But that dollar, the 25 cents you might spend might actually be better in the long run because a lot of the foreign PPE can also be counterfeit or not even pass our standards. The CBC had a great investigation, I believe it was Marketplace, just a few weeks ago, where they tested KN95s from a lot of our pharmacies, retailers, and Amazon. And some of them, which they were supposed to have 95% filtration at minimum, some of them didn't even filter 20%. Mm-hmm. And a lot of them were counterfeit. So how is it that we're buying our large retailers that we trust will hopefully do their own due diligence and research are buying foreign PPE instead of buying it from Canadians, and then they end up with PPE that isn't even safe? And even in Quebec, there was these surgical masks that they gave to school kids in daycares, and they had I forget what chemical it was, but they had dangerous. They had something that was really dangerous that was made from graphene, I think it was.
The masks are bad for you. People will love that one.
Yeah.
Oh God. Is there any way that any of these long-term care homes can start taking their own initiative and sort of go over top of government advice and start using N95s as the minimum, and with because I'm sure a lot of the if you could get some of the seniors in there to use the elastomeric respirators, that'd be good. But understandably, some of them wouldn't want to at times or something like that. But if you had all the workers there using them, and when there's interactions, as well, like all these places should have their ventilation changed now and ramped up too. But like there was a debate in the House on COVID-19, an emergency debate a couple of days ago, and there was a member from Barrie in Ontario who mentioned that there was one of the long-term care homes there where and this wasn't back in the early first wave when there was tons of long-term care homes getting wiped out in Quebec, but it was in the more actually we're in the third wave now, but the one before that, when we were first getting B117 in, and it just wiped out 71 people. And this has been happening on and on throughout the year, and it's just like there's been thousands of senior citizens just in our country that this all could have been prevented with better masks. And it's just it's sad. Like, is there any way that the long-term care homes, like each individual one, can just start taking on their own initiative?
So it's a little bit of a tricky situation because a lot of these long-term care homes are looking to make profit. So some, not all of them are for profit, but a lot of them are. So they're looking to ways to reduce cost. And they'll use the excuse that, well, the government says surgical masks are safe enough. So why would we spend more money to buy other PPE when the government says they're safe enough? So there's no incentive for a lot of places to change what they're doing because the government has said they're safe enough, and the government has yet to make that announcement. So back in October, there was something called Directive 5, which meant healthcare workers who could be exposed to a patient with COVID-19, if they wanted to, they should be able to get an N95 by law. That didn't actually happen. So even now, healthcare workers, if they have COVID patients, even long-term care homes or other places, they'll ask for an N95 and they're told it's not needed, just use your surgical masks, even though there's that law. But then if you look at the Ontario Health Guidelines, they updated their guidelines from the last time was February 25th of 2021. So just about 6 weeks or 7 weeks ago. And on page 7 of the guidelines, it says surgical masks should be used when working around known or suspected cases of or confirmed or suspected patients with COVID. So if the Ontario Health Guidelines say to use specifically just surgical masks around that and to only use N95s during aerosol generating procedures, then all these places are going to be like, okay, well, none of the work they're doing is aerosol generating procedures, so we're just going to give them surgical masks. And it's such negligence because recently experts have found out that aerosol draining procedures produce a lot of virus particles in the air, but simply talking and coughing can produce 20 times the amount of virus particles in these generating procedures. So a lot of healthcare workers, they're given surgical masks and then they get infected and they die. And I remember it was hard not to cry after. In November, I was watching a news story. There was a father, I think it was about a father of 10 in Winnipeg, I think it was. And he was working in a long-term care home, a hospital. And it was a COVID, or I guess it was a hospital, it was a COVID ward. He was only given a surgical mask. He became infected, and then he died about probably 4 or 5 weeks before Christmas. So, and he left like 10 children and quite a few grandchildren and stuff like that. And he was only given a surgical mask. In the Manitoba Nurses Association, I've been asking for a long time for elastomeric, or not for elastomeric respirator, sorry, but for N95s. And after that story came out, I spoke to Mike Sutherland, the director of the Manitoba Nurses Union, and asked him about elastomeric respirators. And he said, you know what? I've noticed a lot about the police and firefighters and paramedics in Winnipeg using it. But when I asked the government about them, they said, oh, there's not enough available or they're too expensive. So the government refused to buy them. And then they only gave them surgical masks. And ironically, Manitoba is the only province that has guidelines, a page just on elastomeric respirators, and has pictures on how to cover the valve. Even though the latest Ontario Health Guidelines do say to cover the valve, often the politicians still say it's dangerous because they have a valve. They don't tell people the valve can be covered, and they don't share the recommendations to cover the valve. So people assume it's just too dangerous to use under any circumstance. And even the short-sightedness of elastomeric respirators, thinking that the valve could potentially infect people, we could have easily given healthcare workers that are working with COVID patients these respirators, because they're given surgical masks, so they're not, the government knows what they're wearing won't protect them against the patients they're treating, and they know the patients don't have to worry about getting infected because they're already infected with the disease. So why couldn't we have, from the very start, when the second they found out it protected healthcare workers, given them to healthcare workers working on COVID patients? So the excuse that, well, the healthcare worker would be safe, but it would be dangerous for the patient, would not hold any water, because the patient is already infected. And that way we can guarantee that the person risking their life could go home at the end of the day and not bring it home to their kids or family.
The valve thing has always gotten me, because I heard about that a little bit early on. Now that I think about it, with elastomeric respirators, like people just trying to write them off right away. Oh, like, well, there's a valve, you can't do that. Or like, it mostly was focused around those I'm not sure if they are called N95s, but you're the mask guru, so you can tell me. But they're N95s, and they got the little plastic valve thing on the front. Are those just N95s with the valve? Is that just what they're called?
They're both exhalation valves on N95s and elastomeric respirators.
Right. Okay.
They kind of work in the same way, but the ones in elastomeric respirators even offer more protection. So there's going to be more things that the valve that will be inside the valve. So it doesn't just open to the air; it actually hits different materials. So the virus particles get impacted with the different things they hit, and it's not also just like the air goes out. So, and it's also, if you think about it, it's also often directed in a certain direction, so often down or to the sides or things like that. But when you look at surgical masks, they have gaps, and same thing with cloth masks. So the people that are sick are going to release a lot more virus particles than would even be possible with the exhalation valve that is so narrow and also has to go through different materials, just like you would a cloth or a surgical mask for the air to go through. So a lot of the virus particles still get stuck and still get filtered. It just doesn't filter to 99.99997%, but it still does a much greater job than what is the most commonly used, cloth and surgical masks.
Yeah, that was my point, is that they're worked up about these valves. Oh, you can't wear one of those N95s with a valve. Oh my God, it's a valve. Well, if you're wearing a surgical mask, or even worse, like what I see most people wearing, not to their fault, to the fault of people who should be advising the public and maybe, slow down on the washing your hands bullshit for 5 seconds and tell people how to wear a mask. Well, you're worried about a valve. Well, if you're wearing a cloth mask, it's not properly around your nose, and it's got a stupid cartoon character on it, and it's just this thing that's just sort of lopped on your face. Well, what's that all around your nose and on the side? Well, it's actually not a valve. That's just a straight opening. Think about like an actual valve, like an actual a mechanism beyond a mask, or if you just had a tap that's straight open. So people are worried about a valve, but you just have straight openings, and that's no problem. So that's just some bit of confusion that's just baffled me. Oh, you got a fancy mask here.
And the listeners won't be able to see, but
right.
As you can see, it's not, the valve has like cloth and different filters inside. So it doesn't just open to the air like people assume, but because people take their assumptions and make themselves experts, the people that are actually experts and do know about exhalation valves are being told by the people that know nothing at all that they're dangerous. And then we don't listen to these experts. Like Lisa Brusso is one of the best experts in the world. She's created implementation guides. She's done so many research papers over the years on healthcare workers, on the use of elastomeric respirators in a healthcare setting. But the government's not really talking to her. Like, why isn't the government talking to these experts? The government would have easily known all their misinformation and all their assumptions were wrong simply either by listening to their own CDC researchers, looking at the CDC website, or speaking to all these experts from around the US or Canada on elastomeric respirators. Excuse me, but whenever there's information, it doesn't actually get shared. It just gets updated on the website and then completely overlooked and ignored. And then the CDC will keep saying, even though their studies have proven things, they'll keep saying the opposite because sometimes the CDC director might not even know their own studies. So the CDC came out with studies, I believe it was in December, showing that the exhalation valve was not dangerous, but that the surgical masks were not dangerous. But the CDC has also been saying for years, they've known surgical masks would not protect against infection. So why has the CDC told healthcare workers to use surgical masks if they know they won't protect them? It's such a weird situation where if you go and you Google, for example, CDC difference between surgical mask and N95 elastomeric respirators, there's a great CDC page that shows all three on like a poster, and it even says surgical masks are not respiratory protection. They allow air to leak in and out, and they don't protect people wearing them from infection. And then for the N95, it says it protects you from 95% of the airborne particles, including viruses, but that it should be disposed of after every patient interaction. And that hasn't been the case since the start of the pandemic, because everyone's using the excuse of an N95 shortage to reuse N95s instead of actually using reusable respirators that offer more protection than N95s. So and then when you look at the category where it says elastomeric respirators, it says you can use a filter to have either 95%, 99%, or 100% protection, and they're made to be reused. So what would you like? Would you like to use something that will just be good for show and will protect others but won't protect you? Or will you use something that will protect others and yourself as well? So it's an easy solution, but unless you don't know that solution exists, it's very easy to overlook and not realize it's there.
You had your fancy mask sitting there. So you're saying that some people are saying, well, these are impossible to communicate with. Just slap it on your face real quick. Let's see how impossible this is.
I have to quickly put this one back on. I just took it apart so I can quickly wash it yesterday.
Okay, so what he has here, he pulled out a different one. He's got his fancy.
This is the canopy one I got a couple of days ago. It's not available in Canada. It's American right now. It's going through the approval process, but it's a great example of. Actually, here one sec. I'll just use the Dormo one. That's a great.
Yeah, grab your black one. But just for the listeners, he has another mask that he got his hands on that maybe we'll be able to get. Where it has a translucent screen on the front, so you can actually see your mouth move. But now he has a different one on. So just say a few things real quick.
So I'm wearing this one by Dorma. So you can it does muffle a little bit, but you could still clearly hear everything that's going on. And if you were wearing an example of an N95, it would be even more muffled than this. Here, I'll try just holding this one together with the part on.
So this is the 2001: A Space Odyssey looking clear one that he's got coming here.
I made a few videos for Twitter with it yesterday and this morning, so I took it apart. Sorry. I remember how I put it. Okay, so it's top goes with this piece right here.
Let's scrap that one. Just grab your black one. That kind of looks like something I would expect, somebody
the
on a construction site to wear. Yeah.
So this is an example of a 3M industrial. So it does muffle a little bit, but that's a version of industrial that was made 20 years ago. It wasn't one of the ones made during the pandemic, but you could still hear people. That was a half face. And then an example of full face. This is an example of full face, so it'll protect the eyes and the mouth as well. And you could, I don't know, like I don't know what you're hearing, but it does muffle a little bit, but you could still hear what the person is saying.
Yeah. So from that, your smaller white one, it actually made no change in your voice, and then there was some muffling from the other two. Point being, quite a far cry from impossible. Now,
for some people, for some people, if communication is really important, then you'd look at getting like a healthcare worker version. But if you're just an example of an employee on an assembly line at a food plant where you're not talking to somebody, then you don't necessarily need to get a healthcare worker. You can get just the general industrial ones, and then your employer can even use it for other things after as well.
Yeah, and like as we mentioned, like people would still wear these things all the time. It's not like somebody on a construction site or at a mine or wherever, like they have to have some sort of microphone apparatus within their mask to communicate with each other. Is it like they're fighter pilots or something? Like it's ridiculous. Now,
well, that's actually something else. And some elastomeric respirators have something called a speech diaphragm, which is kind of like that, and it just augments the volume of the person. So it's a different way to increase communication as well.
Oh, okay. Now, I think and this is something we touched on a bit before with the filters, and I said we're going to get back to. Something that people would be concerned about is the cost, and more so for the individuals. Like you mentioned that Cargill in the meatpacking plant, it would have to spend $15,000 to upgrade their masks, or to respirators. But this is also a long-term investment, and also as well too. When you think of something like Cargill, like $15,000, that seems like an accounting error.
Mhm.
Yeah, that's just that doesn't seem like much of a cost. Like you could have a piece of machinery that breaks, and you could easily see a $15,000 repair. Much less having these respirators for all your employees. So what is sort of the cost range of the masks for anybody wondering?
So if you're looking at an individual, if you were to buy a large amount, it would be a lot less. But as a single unit, they start at $15 and the filters start at $2. So very, very reasonable cost. And then they some can go to hundreds of dollars for the really more advanced versions and stuff like that. But you can get a great version for $15. And for example, the one that was used at the Allegheny Health Network is the MSA safety one. And that was a $15 one. So it's not necessarily the best mask there is. There's quite a few others that are great as well. And the average price would probably be about $25 to $50. And the other great reasons why they'd be good compared to cloth masks and things like that in other places is because they're also made, since they're often made for industrial uses, they're made to be able to be exposed to chemicals or substances that would normally degrade a mask or things like that. So if you're working at a food plant, for example, or a meat plant, and you're exposed to blood or things like that, it's not going to soak into the cloth mask. It could just drip off, and it's not going to degrade the filter either. So sometimes N95s are made to have a little bit of splash resistance and things like that. But if you're using it, for example, outside and you're using it in rain, it might be harder to use surgical or N95 because if there's constant water going down, it might be harder. But you can get an elastomeric respirator that's made to be used outside where the water is not going to affect the respirator or the filtration.
Yeah, so they don't cost very much. And like
Nope.
you mentioned $15, I'm assuming you meant 15 Canadian dollars. And
Yeah.
so for everybody listening outside of Canada, that's like $11 US, maybe £8.50 over in the UK, something like that. Like that, it's extremely cheap, and and then just a few bucks for the filters. Like that's just going to be a couple bucks more than what I paid for my box of shitty Costco KN95s. And you have a respirator and some filters, and and just double that, you have a better respirator.
Absolutely. And a good way to also look at it is, so when I did my presentation in July, I wanted to also be able to offer solutions to the government for protecting all the healthcare workers across Canada, even though it was an Ontario Parliament. I want to let them know what was possible. So I have great relations with a lot of the manufacturers in Canada, the US, and the UK. So I spoke to quite a few, and I said, how much would it be if you were to supply 500,000 of your elastomeric respirators to the Canadian government or the provinces and territories, and that way every single healthcare worker in Canada could have their own? Well, it was between $8 and $15 million. So if you look at $8 to $15 million, that means an $8 to $15 million investment on a reusable respirator that you won't have to buy other PPE again. And then if you look just at, for example, at what they're spending on surgical masks, which don't protect the healthcare workers, they're spending hundreds of millions of dollars. So for about 5% of what you can spend on PPE that doesn't actually work at all to protect you, you can actually save the taxpayer hundreds of millions of dollars. You can protect the people you're trying to protect. And then you're going to protect also more money in the long run because these people aren't going to get sick. So you don't have to necessarily pay them for the next 2 weeks to isolate because they've become infected, and you're still paying them. Although the government's lacking on that as well. Some employers will pay you for while you're sick and infected to recover a sick pay. But the government, for example, in Ontario, Doug Ford's still resisting to offer the 10 paid sick days. So people that are getting infected, and a lot of it is the people that don't make very much money. They can't afford to lose work. And so if they're not going to get paid to be home, they're going into work infected because they don't have any other options. If they had paid time off when they became infected, they would stay home and then they wouldn't be infecting their coworkers. So sometimes they also might not want to get tested because if they're tested and it shows positive, then they might have to stay home. So they might have the symptoms, but they might avoid being tested because they don't want to lose that money, because they might have a mortgage payment or a rent payment, or they might have to buy diapers or something for their kids. And if they have to go home for 2 weeks and don't get paid, then that might mean they can't put food on the table, or they might miss some payments and fall behind. So it's really tough tough choices. So the Canadian government could also subsidize PPE for businesses and the public. In Europe, some countries like Germany, Bavaria, and other countries are requiring N95s at a minimum for even using public transportation or going into a store. So if you're going to do groceries, you're going to need an N95 mask at a minimum. While in Canada, you're a healthcare worker working on a COVID patient, you're being told by the government to use a surgical mask. And then other countries like Bavaria have also paid for
Bavaria is a state in Germany.
Oh, sorry. I guess maybe it's a state of Bavaria, the state of Germany. I could be confusing some of the countries as well, but they subsidized, I think it was for 30 million people, N95. So they gave vouchers to people so they can get 12 free N95s at their pharmacies or supermarket. And they've also made N95s very cheap by subsidizing it, so everybody can easily afford to get one. So they don't have to worry about not buying PPE because they can't afford it. So there's no reason the Canadian government couldn't subsidize PPE as well and make a deal with manufacturers. And any excess PPE we have, we can even donate to third world countries. Canada is often known for helping countries in Africa, Asia, South America. There's no reason why we can't get our manufacturers to support our manufacturers, get PPE manufacturing up to what it could be, and not slow down simply because of bureaucracy. And then once the production capacity is back up, supply all Canadians, all our friends and neighbors in the States, and then also all these other countries, and then donate it to countries that can't afford it, because it's not a Canadian effort to fight the pandemic. It's a global effort. And unless we help the other countries stop the spread, we're going to be worrying about this pandemic for years. So a lot of other countries, they don't have the luxury of Canada to afford the vaccine. So a lot of countries won't be able to vaccinate their citizens for a long time. So mask is like a virtual way to vaccinate. Mask is like offering virtual protection. So if you have a proper mask and you're trained to use it and it's the right size, then you're not going to get infected. So it could keep you safe until you receive that vaccination. So if it takes a year to become vaccinated in the third world, it might take a year, but at least you'll have the right protections. So we don't have to worry about having to deal with things like famine or things like that in the other countries, because all their workers were decimated, their healthcare system was decimated, and now we have all these other things to have to help to try and help them out. So it's there's quite a bit, like, as a country we can do, and it's easy to do. We just need the support of our government.
Yeah, and as I got you to outline there, it's actually really, really cheap, and these are all things that people should actually, for reasons you've sort of scattered throughout this conversation, people should have on hand anyway for a whole bunch of reasons. And like I said, I was going to touch on it, but I think I got to sort of skim over it now. But like the economic cost that we've seen, this all could have been prevented from this cheap investment. Relatively very cheap investment on these masks, and just getting people to wear them and help people out with that. Like even having, just like you mentioned in Europe, but I've heard throughout the course of the pandemic, like even with the surgical masks, like all sorts of places, you have countries with a lot smaller of an economy than Canada, the 10th largest economy, buying masks for their population. Here you go. I think it was somewhere in Indochina. Like I think it was Thailand, maybe. They just were just giving people masks. It's just crazy, and like I think what a lot of people are most worried about, and it's a huge issue in Canada. And then like the sums in the United States look daunting. Like the last bill or stimulus package was 1.9 trillion. But like the United States, they can keep doing this for a while. They have the main reserve currency. They have their own central bank, as do we. A lot of European countries don't have that luxury. They got to go through Frankfurt. But like the United States can keep printing this money. But, it's still, we got to pay off the debt at some point, more so in Canada than the United States. We don't have that luxury of being so much of a reserve currency. Canadian bonds aren't a market like American bonds. But, so that's what gets a lot of the press is, how much is being spent from the governments. But the amount of household debt and corporate debt that's been building up in Canada is just extreme. And, that can cause a huge collapse later on, not to mention like allowing this just to continue. And even if you have things open, like there's still going to be a lot of businesses that close down because, there's going to be a certain quantity of the clientele that are just not going to be patrons, out of their own choices. It's going to keep hurting the economy.
And the supply chain is not going to be stable unless we protect it.
Yeah, you're never going to have guaranteed stability of supply chains. Absolutely. You're going to have businesses keep going into insolvency. You're going to have every sort of debt outside of government debt still accumulating. And like there's the other factors, but the big one is that we could have just had so many better masks and respirators for relatively cheap cost. So like, I think we should leave it there on the economic front, but like, with this degree of negligence, and you pointed out before, Doug Ford, trying to cover up some things, and you were working with various New Democrats, provincial and federal, and outside of this conversation, you mentioned to me before, the one, I believe it was the provincial New Democrat, who at first was gung-ho about masks, and then she sort of left you in the ditch. And then she was trying to pass a bill, where she's worried about Doritos at the fucking cash out. And then as well, too, I found out, it's been found out this week that Jason Kenney, the premier of Alberta, he was making sure that his public health team in Edmonton weren't putting out modeling for the population, and then the only person who was a scientist on her own accord at the University of Calgary. And so the amount of moral bankruptcy and politicians only worried about optics and their own political capital is stunning. Where you surprised as you've seen these things sort of roll out, this level of just negligence and corruption, and also just really deep cynicism? Could you have seen these sorts of things a year and a half ago? And was a lot of this really shocking to you as it sort of unrolled on so many different levels of government throughout the year, and in Ottawa and a whole bunch of provinces?
It's one of the most shocking things I've ever experienced. I would have never thought of this would happen either. Like I thought a year ago when I brought elastomeric respirators up, within a week or two, especially this is when the U.S. was saying they wanted to ban N95 exports to Canada because there wouldn't be enough N95s for the States. So I thought it would just be a week or two. And I always had hope because right away when Franchina told me the government found out it would protect the healthcare worker at least as good as an N95, I said, okay, well, that's great. Like they might not realize certain things because they didn't hire the right experts, but at least they know a few things. And then I remember asking her, I said, mining companies don't want to donate it because they think it's now dangerous because you said it was dangerous in an interview, and the government has also said it's dangerous. Can you just let the people know that they've been used for a long time, that they're not dangerous, they're not impossible to communicate in, and to criticize Ford for not properly hiring experts? And she said, well, you know what? I'll criticize Ford, but I have to wait till after the approval process because there's a bureaucratic process, so I have to wait. And I said, well, if you wait, it's going to look bad for you, and a lot of people are going to die, and you shouldn't put a bureaucratic process over the lives of the people. You should just adapt the process to the situation. And she said, no, I'll criticize once it's approved, and I have to wait. My hands are tied. And then it ended up getting approved on May 10th. And she didn't say anything even then. And then 2 weeks later, she told me that she would not criticize Ford because the government, she was part of the government panel with COVID people And she said the government decided that they wouldn't be using elastomeric respirators. So it wouldn't be worth criticizing Ford for not hiring proper experts or telling people. And even though healthcare workers were actively prevented because hospitals thought they were dangerous, she didn't want to make any message. And then the next day after she told me that, that's when the Radio-Canada came out with their article about how Health Canada was starting the approval process. So I said, okay, you know what? Now the Canadian government's going to be recommending that. The Radio-Canada just came out with their investigation. So you can use this news article to say, why isn't Ford letting anybody know about the recommendations that came out weeks ago for Ontario so that we could start using these? Healthcare workers are continue to be told that they can't even get an N95 or they'll have to use it the same one for weeks at a time. So don't lose it because there's a PPE shortage. But the government just said that there's these N95 alternatives that they recommend. So just let businesses know. And she said, well, as soon as Health Canada comes out with their approval process, I'll say something then. So I said, well, that's still waiting. People are going to die. And I said, you should say something. She's like, okay, well, I'm just going to say something once the guidelines come out from Health Canada. A week come by and she lets me know, oh, Health Canada called me and they wanted to let me know like what information I have about elastomeric respirators. I'm getting my information from you. So I want to know what I should tell them. I said, give them my goddamn number. Like I've been trying to get a hold of Health Canada. I've asked the NDP to get me in touch with other politicians like the Liberal Party in Canada and the PC Party in Ontario so I can get in direct contact. So I can at least have a phone conversation, explain things to them. But the NDP said, it's not our party or I'm provincial and I don't deal with federal, so I'm not going to help you get in touch with any of these people. So that was a lost opportunity. And then a week after that, Health Canada had still not called me. So I ended up using networking connections I had to find out who I should talk to at Health Canada. And within a couple of days, I found the right person. So on the Monday, I think it was Monday, June 8th, I sent an email, like a detailed 3-page email with list of experts, the resources, these news articles, the CDC recommendations. I think I even sent the Ontario Health recommendations. I sent the New York Times article, the USA article, the CDC presentations from 2017 talking about them, even old manuals from Canada from like 2004 that was talking about after SARS in BC about how we needed to use elastomeric respirators to prevent things like SARS in the future. And then I also put about 12 different experts that Health Canada could talk to even learn more. And on the Friday morning, I received an email from David Boudreau, the Directorate General from Health Canada, thanked me for that. And he said, thanks to the information I provided and the experts, they had talked to a few people and they immediately updated the Health Canada website to start recommending elastomeric respirators as safe N95 alternatives. And it would have normally taken a long time, but because I had also was able to get a few journalists to start asking them questions, they had public pressure to do it right away. So they ended up updating it right away. But then once they came out with their recommendations, Franchina said it wouldn't be worth bringing it up anymore for some weird reason. And then I contacted Doug Ford's office and I said, you know, you guys recommended these respirators a month ago. Nobody knows they're safe. People still are saying they're dangerous. What's going on? Why can't you let people know? And then that ended up, that email got to David Morgado, Doug Ford's personal assistant. And on June 29th, he sent me an email, which the bottom of the email started from my original email asking for an investigation. And then it had a back and forth between the top people at Ontario Health and Doug Ford's office saying that elastomeric respirators should have been used. They don't know why healthcare workers are being actively prevented. They should not be actively prevented from using them because they're safe. And that because of that investigation, they decided to buy 100,000 elastomeric respirators from 3M. They had already received the first 25,000 by that point, and they would receive the other 75,000 at the end of, the middle of July. So Franchina also sent me a message to let me know about that purchase as well. But then a few weeks later, Franchina let me know that the government decided not to distribute them, that it wouldn't be worth handing out to healthcare workers because they assumed healthcare workers would not want them. So I said, well, why would you not talk to unions before making that decision? Because unions are asking for them. Here's a CTV News article from early April where these unions are specifically asking for elastomeric respirators. Here is all these people saying they want elastomeric respirators. Here's a study where 2,000 out of 2,000, not a single one person wanted to stop using the respirators. And they're safer than N95s, and what is now is not working. So why would you at least not criticize Ford for making that kind of decision, or at least talk to unions to confirm that healthcare workers would not want it. Oh no, it's not worth it. And then I also asked Franchina, since she was the politician to help me work, the government has misinformation about the respirators being dangerous and things like that. People are going to see that and assume that it's fact since it comes from the government. Can you at least get the government to take that down? And she didn't ask them to take it down. So the next month, CTV came out with an article, avoid any mask with a valve because they're dangerous, and it cited the government website. And then even after that, it didn't get taken down. So in November, CBC Marketplace came out with an article citing the same government websites with the misinformation, because the misinformation had not been taken down, even though other parts of the website said to use elastomeric respirators. So there was so many opportunities to actually basically all she would have had to do was tell journalists what was going on, criticize Ford. She's a health critic, but she can't criticize the biggest health problem despite knowing it's costing lives. And I told her that a lot of journalists were ready to publish articles, including the New York Times, but they just needed the government to confirm that they had been recommended. They just need an official confirmation from the government about the recommendations, because the government had only updated websites. And updating a website is not good enough if the government's not letting anybody know to even look at that website, or that website is there. But nothing changed. And then the journalist I was originally working with, Chris Hamby from the New York Times, in September, he said he was going to start working on a documentary so he could no longer follow what was going on in Canada and wait for the Canadian government to finally acknowledge that they had recommended these respirators months before. So I assumed I have been an NDP and Liberal voter my entire life. Franchina is actually my politician, and she sat on a board in Sudbury where my mother was on the board, and they have a friend in common. And Carol Hughes is a politician from Elliott Lake that used to work with my mother, and my mother convinced her to run as a politician and supported them. So I assume these people are great people. I've only seen them great work, and they were heroes to me. Like, Carol and Franchina were two of my favorite politicians. I thought if anybody could do something, these two people are great. They're great politicians. So I asked them, but then they kept refusing. And then at a certain point, they made so many mistakes. It was hard to then say, you know what, we should have listened to you from the start. We should have criticized Ford, criticized Trudeau, or done anything like that. And then when I was talking to other politicians like Don Davies, the federal health critic for the NDP, he admitted to me, he's like, yeah, these respirators definitely look great. I don't know why they're not being used. They should be used. Like, what do you suggest I do? And at that time, I was still supporting the NDP, because I said, talk to Franchina, you should come up with a plan, because you should say something in combination with her so the NDP in Ontario doesn't look bad. And then after he spoke to Franchina, he's like, you know what? I can't talk about elastomeric respirators. I'm not a scientist, so I can't even share the recommendations to use them on my social media. And then when it came time to the NDP talking about PPE, like from September to December, the NDP, especially Franchina and Jamie West, kept saying, so many people are dying just because there's no N95s. Some long-term care homes are in outbreaks and haven't had a single N95 for months. So they knew the government had 100,000 respirators, which would have protected 4 to 5 healthcare workers with N95 alternatives. So why couldn't they also ask the government to distribute them if they knew it would protect them? They knew the alternative was to keep using surgical masks, and they would keep getting infected and dying. So why was that a better option than simply letting people know about the stockpile? And then in December, when Radio-Canada came out with their investigation showing unions were fighting with the government, why wouldn't the NDP then say, you know what, we don't think it's right for unions to have to fight the government to get PPE when it's available and it's already been purchased? The NDP then told me, we don't know nobody's asking for elastomeric respirators. Unions are not asking for it. And then I'd show them the videos from the news article, all the things from the unions that have been put up and stuff like that. And then they're like, oh, that's quite a few resources. Yeah, I guess they are asking for it, but they're not asking us specifically for help. So we're not gonna help unions because they're not asking for us specifically. But if they ask for our help, we'll help them. And that's when I'm like, okay, well, and they even tweeted this. So their tweets are online saying that we would help if they would ask, but they're simply only asking for N95s. So I took that information. I went to these unions. I said, these politicians are making excuses that you're not asking for elastomeric respirators, but they said they would gladly help get the government to promote the recommendations to use them and distribute them. And all you have to do is say you want their help. But then unions said, no, we don't need help. We know what we're doing. We're going to focus on N95s. We're not going to ask. We're just going to try and get more N95s. We're not going to ask for anything around elastomeric respirators. So nothing happened. And then when I talked to journalists, and journalists said, well, if unions ask for it, we'll start investigating. But unions weren't asking for it. They sometimes would mention it as like a secondary part. In 1,000 words, they would say, well, we need N95s. We need N95s. Surgical masks aren't safe. We need N95s at minimum, but never say N95s are better, but they would never say what that better was. They would just say N95 or better. And I even say, if you're going to say N95 or better, at least say elastomeric respirators, so journalists would have that on their radar. But because journalists don't have it on their radars, they can't investigate the failure for the government to not let anybody know about the recommendations because they've never heard of the recommendations or the respirators. They can't ask Ford why he's not distributing them because they don't know there's 100,000 respirators sitting there in a warehouse collecting dust while healthcare workers are dying. So unless you speak out and say it's important, people are going to keep dying and it's going to keep being overlooked. And I had a lot of nurses. So to understand the problems, it's not just experts I talked to. I probably joined about 15 different groups of advocacy on Facebook between nursing, frontline workers, long-term care homes, just general things in COVID to understand the issues. And I had quite a few nurses tell me, we've gone to our union, complained 5 times that our long-term care home has elastomeric respirators and they're not letting us use them. They say you only need a surgical mask, so they're not letting us use it even though they have it. And after the 4th or 5th time, and the union hasn't even bothered to help us out or criticize the homes or do anything like that, we're not going to keep criticizing because every time we criticize or speak out, we're afraid of losing our jobs and we don't want to lose our jobs. And then some healthcare workers have even quit their profession because they felt that they've been abandoned by their unions. And, there are some great unions out there and they do great work. It's just some little things here that where the union would normally be the safeguard to prevent these problems from happening. The unions are allowing them to happen because they're trying to put all their eggs in the N95 basket and ignoring ignoring the other solutions for the most part, while quietly saying they do want them.
Yeah, just a complete year of a nightmare. And for the on the similar end in Ottawa, we don't see a whole lot of hope there. Our health minister on the federal level seems to think that it's a good idea not to wear any mask at all in an airport. And I think our shadow minister of health is incapable of mustering up an intelligent thought on anything at any point in time, I'm afraid to say. Anyway, Nicolas, I think we should call it a day there. We covered a lot of ground, and I got to say, this is a pretty. I think there's some signs of hope for the future from what you've outlined, and I think a lot of things have moved recently. And even if the rest of this pandemic, which could be another month or maybe another 3 years, we don't know, could be a whole catastrophe the whole way through. I think there's enough bricks that can be laid to set everything up properly for the next pandemic. So before I let you go, just sort of let the audience know, where they could go get a good respirator right now. What are some quick, easy, simple options that they could do? And if you recommend what they could say to any of their local members of Congress or members of Parliament to try to make some change with where they are as far as the official policies on masks and respirators.
So there's quite a few places you can go to. Amazon actually sells a lot of different elastomeric respirators. So if you like Amazon, you can use Amazon. But a lot of the manufacturers do sell it directly from their own websites as well. So for example, in Canada, there's Dorma, Precision ADM, MSA Safety, 3M, Prescient, Trevor RX, and I forget, I'm probably forgetting a couple others. And in the US, there's even quite a few more. So there's Castle Grade, there's Any, there's Canopy One, there's Mask Force. There is Breathe 99. So I'm trying to remember all of them. And there's also GVS, which is a European one, but that's available in Canada and the US as well. And but if all you have time to do is look on Amazon and you want your free shipping, that's a great option. As for what you can ask your politicians to do, just say, just ask the government to let people know about the recommendations that came out a year ago, because they're overlooked and misunderstood. And unless people know about the recommendations, they're going to keep taking shortcuts and making assumptions. And they're going to keep, if they don't know that there's healthcare worker versions of these respirators, they're also going to believe that they're all the same. And if they hear somebody saying that they're impossible to communicate through, they won't look further. If they hear that they're too expensive, they're not going to look into buying them. If they hear that they're not that they're going to scare patients away because they're scary looking, then they might not use that either, or they're fashionable. But some companies have even made some to be more fashionable. So they're all multicolored. They don't have the filters on the side. It's just like one piece. So, because I've heard quite a few times, I'm not going to wear an elastomeric respirator. It doesn't look fashionable enough. So people are more interested in looking good than staying alive or keeping the infection out of their homes. So there needs to be an awareness program. So the politicians in Canada and the US not only need to let the public know about the recommendations to use them, but they also have to let them know about all the manufacturers that exist and about where to go to buy them. And they also have to show them that you have to be fit tested. So they have to show them maybe where the places have a locations where they could be fit tested, but people can even fit test themselves. There's fit test kits you can buy online if you want to fit test your own as well. And some of these manufacturers will also go into a workplace setting and fit test the entire workforce. In that way, let's say it's a hospital, you fit test every healthcare worker at the hospital on site and give them the respirator on site. So also to ask their politicians to look at supporting people that can't afford it. So nonprofits, so places like Big Brothers, Big Sisters, and things like that, they can keep doing good. They could start opening their operations again. And even like places in soup kitchens and homeless shelters, they might not necessarily be able to afford PPE, but that's a big place that the virus spreads. So if we could protect the places there by the government subsidizing and donating the PPE, or even corporations knowing, because a corporation could easily get a big tax break and great publicity by donating a large amount of PPE, and it wouldn't cost them very much. You could protect 1 million people for a $10 to $15 million tax donation, and that would get you great press, and then that would create so much goodwill for your company, and the company would get more in return than just the $15 million tax credit. So these companies could benefit from knowing that these are available as well, because they can bypass the government. The government is pretty terrible in procurement. So if we bypass the government altogether and use private corporations, these companies could donate them to healthcare workers or people that need them, that are at high risk, and that simply can't get their employers to buy them or can't buy them themselves.
Well, there you go, folks. Where can people keep tabs on you?
I have Twitter and LinkedIn are two places. So if you type in Nicolas Smit, Nicolas Smit, and P100, you'll in Google, or elastomeric respirator with my name in Google, you can usually find my LinkedIn account or Twitter. If you go on LinkedIn and you just type in my name, if you type in Subway, you could find me there. And on Twitter, it's PPE to Heroes. Although I believe I misspelled heroes. So Google Nicolas Smit and P100 in Twitter, and then you can find my Twitter account as well.
Cool. Well, whatever the spelling is, I'll have it written in the description for the episode. So if Nick's confused you can find it there, folks. Mm-hmm. Awesome. Thanks so much, man.
All right. Well, thank you.
Thanks for listening to this episode. The music you hear on this show is from the Jeff Lapp Trio out of Montreal. Find them at jefflapp.com. Shout out to Tara for doing the graphics for COVID On Air. A huge thanks to my editor, Jeff, at Bean Co. Studios in Regina, Saskatchewan. Please visit endcoronavirus.org for more information on ECV. Click on Join Us. Through that, you can volunteer with ECV, and you can subscribe to our newsletter, which is full of great information shot straight to your inbox from our delightful newsletter editor, Tracy. Also, please check out the blog at ECV, and hats off to Scott, our impeccable blog editor. You can find ECV on Facebook and Instagram and on Twitter at NCovid19. You can find me on Twitter at Mr. Farden. It's at MRFARDEN. Till next time.